Assemblymember Kennedy. Assemblymember Zolotel, can you hear us?
Yes.
Oh, did you? Assemblymember Kennedy, can you hear us?
Constance, can you hear me?
This is Meg. Salatel. If you can hear me, let me know, please.
I can hear you, Meg. Constance here.
Thanks for a second.
So
It's Chambers. They're having
this is the assembly
maybe an issue hearing us.
and they're not. Assemblymember Zolotel, can you hear us?
Yes, I can hear you well.
Can I ask you to say that again?
Sure, I said yes, I can hear you well.
Okay, thank you. Assemblymember Kennedy, can you hear us? Assemblymember Perez-Verdia, can you hear us?
Yep, I can hear you pretty well.
Thank you. Assemblymember Dunbar, can you hear us?
Yes.
Thank you.
For folks on the phone, we're going to get started here in a minute. I'd like to call this special meeting of the Anchorage Assembly to order. Madam Clerk, can you please call the roll?
Miss Allard?
Here.
Mr. Peterson?
Present.
Thank you, Mr. Peterson. Ms. LaFrance?
Here.
Mr. Dunbar?
Here.
Mr. Dunbar, could you repeat that for us, please?
Here.
So, Mr. Dunbar, we can hear you, but you're very soft on our end, so I don't know if you could speak louder or closer to the mic, please. Thank you.
I'm speaking loudly directly into the phone. The other folks were soft on my line too.
Yeah. Okay, we will troubleshoot and see what we can do on our end. Thanks.
Mr. Rivera?
Present.
Mr. Weddleton?
Here.
Mr. Constant?
Here, but I'm having a similar problem to Mr. Dunbar. I can barely hear you, but I have the phone right to my mouth.
Thank you, Mr. Constant. Miss Kennedy?
Here.
Mr. Perez-Verdilla?
Here, and everybody sounds great to me.
Ms. Solotel?
Here.
You have a quorum, Mr. Chair.
Thank you, Madam Clerk. So, before I go on to the next item on our agenda, I understand that several members of our community have reached out about the Pledge of Allegiance and not being able to hear the pledge when watching online or via TV. Up until, this was not raised up until last week, so I do not know that this was an issue. I can assure you that neither I nor the staff have purposefully muted the audio when we do the pledge. The real answer is actually very simple. When none of the mics are turned on, and when no one is speaking into a mic, those watching online or on TV cannot hear what is going on. So it creates the appearance that someone muted the audio. To correct this issue, I'll be asking that anyone who leads us in the pledge stand at the testimony podium with the mic on. I'll also invite anyone on the dais with a mic to turn on your mic before standing up. Although I'm not sure that will be helpful, as you need to be within 6 inches of the mic for the sound to be picked up clearly. With that, I'm going to ask Mr. Weddleton to lead us and show us how to do it.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Weddleton. Next, we're going to go to the land acknowledgement. Hopefully we can hear you a little better, Mr. Dunbar, so if you could go ahead and read that, please.
A land acknowledgement is a formal statement recognizing the indigenous people of a place. It is a public gesture of appreciation for the past and present indigenous stewardship of the lands that we now occupy. It is an actionable statement that marks our collective movement towards decolonization and equity. The Anchorage Assembly would like to acknowledge that we gather today on the traditional lands of the Dena'ina Athabascan. For thousands of years, the Dena'ina have been and continue to be the stewards of this land. It is with gratefulness and respect that we recognize the contributions, innovations, and contemporary perspectives of the Upper Cook Inlet Dena'ina.
Thank you. All right. So before we go to item 4A on our agenda, I want to cover a few things. So first, just my normal reminder of the rules in the chamber regarding COVID-19, and I appreciate seeing folks most folks wearing your mask. So masks are required in the chambers to be worn at all times unless drinking water or unless you're coming up to the podium to speak. Speaking of, as you may have noticed, the first 2 rows, we have caution tape on those, and that is to allow members of the audience who wish to take off their mask while they're speaking the ability to continue to do so. As some may know, the new emergency order does not give that flexibility, so this was our compromise to try to make sure that we can keep people healthy and allow folks to take off their masks if they wish to speak at the podium. Okay, so last quick update. So for members of the public who have been reading the yellow posted signs on the walls, those are our rules of decorum in the chambers. There was an update to those rules regarding clapping. As happened at the last meeting, Assembly members did clap during the recognition resolutions, which is a time to honor, for example, we honored Veterans Day. Obviously, we want to clap during that recognition resolution. So it was not meant for us when crafting these rules to prohibit us from clapping during those types of recognition resolutions. So that exception is clearly outlined now in the rules of decorum for the chambers. Okay, so moving on, we're going to have a couple of quick comments and presentations before we get to the public hearing. So first I'm going to turn it over to the administration.
Thank you, Mr. Chair. This is Austin Quinn Davidson. Can you hear me?
Yes, we can hear you.
Thank you. Thanks for the opportunity to share the administration's perspective this evening. And before commenting on the emergency, I just want to acknowledge how difficult the situation has become for everyone. We've been dealing with the pandemic now for 8 months, and that's a long time, and we are all tired of it. Parents who are juggling childcare and school and day jobs are tired. Businesses have had to overhaul how they operate, and across the board have fewer customers. Families are struggling to pay rent. Kids are navigating virtual or homeschooling, and thousands of Anchorage residents have gotten sick. Many have recovered quickly.
I'm sorry, if I can interrupt you briefly, Madam Mayor. So for other folks that are on the line, if you could please mute yourselves, we're getting a little bit of feedback. So if you're not speaking, please mute yourself. Go ahead, Madam Mayor.
Thank you, Mr. Chair. Thousands of residents have gotten sick. Many have recovered quickly, but even young, otherwise healthy people have been hospitalized and are dealing with the long-term effects of the virus months after they were infected. As many of you know, we've lost 60 Anchorage residents to COVID-19, and last week, a young Anchorage woman in her 20s passed away from the virus. Our personal beliefs are based on what we've seen or know to be true, and so it makes sense that our decisions about COVID in Alaska would so far be shaped by the fact that we have not yet witnessed how bad things can get. It has never been as bad here as it was early on in New York, where people got used to the constant sirens of ambulances. We hunkered down early, tested widely, stood up an effective contact tracing program, put in place sensible public health measures, and as a result, we've been able to keep room in our hospitals. We now find ourselves in a more dangerous position than we have at any point in the pandemic. My goal here is not to spread fear, but to be transparent and honest about what I'm hearing from hospitals, from doctors, and our public health team. They are all extremely worried about what comes next. Each of the past few weeks has brought a record-breaking number of cases. Hundreds of new cases are reported every day, and our public health capacity simply cannot keep up. 486 cases were reported on Saturday alone. We kept the lid on COVID-19 for so long in part because we set up a robust contact tracing system early on. That system is now overwhelmed and cannot keep up with the number of cases we're seeing. We also stood out nationally for how much testing we were conducting, which is another important way of keeping the virus under control. For months, we kept our test positivity rate below 2%. Now, over 10% of people who get a COVID test get a positive result back, which is a sign that we are not testing nearly enough to catch all of the cases out there. And most concerningly, we are seeing our hospitals fill to capacity. The Anchorage Health Department reports that the total number of available ICU beds in Anchorage has dropped to 11. Hospitals are extremely concerned about staffing levels as more and more healthcare workers get COVID because of the level of community spread. Help is not on the way. Cases are spiking across the country and healthcare workers are in demand everywhere. The only thing we can do is protect our current healthcare workforce. At the current rate of spread, we expect to overwhelm our hospital's capacity to treat critical patients by the end of the year. We do not want to be in that situation. We do not want to be in a situation where hospital staff have to make life and death decisions about who gets treatment and who doesn't. We are all tired, but as Anchorage residents, we also shoulder an incredible responsibility to the entire state. Anchorage hospitals are the healthcare providers for most of Alaska. The decisions we all make will not only affect the people who need care here in Anchorage, but anyone who is critically ill from across the state who would seek care in Anchorage. With that responsibility in mind, let me briefly comment on the decision at hand this evening. The administration is requesting an extension of the emergency declaration, which gives us the tools to respond to the pandemic. As a reminder to those listening, the emergency declaration allows the municipality to reassign personnel to respond to the emergency. It allows us to procure emergency supplies quickly. It allows us to issue emergency orders, like the ones that currently require mask wearing, capacity limits, and gathering limitations. And it also allows us to take swift action, like creating temporary housing, such as standing up the shelter at the Sullivan Arena. As acting mayor, I recognize the weight of this responsibility and have exercised these emergency powers only to the extent necessary to protect the safety of our community. We have worked hard to communicate with the public and to give people the chance to make the decisions necessary to bring the situation under control. We've made it 8 months, and the hardest months may very well be yet to come. But let's also remember this will not last forever. This will not last forever. This morning, the drug maker Moderna announced that its vaccine is 94.5% effective, according to early data. Last week, another company, Pfizer, announced its vaccine looked like it was 90% effective. This is much better news than many experts were even hoping for. We could see limited distribution of a vaccine to high-risk groups by the end of the year. In the meantime, we need Congress to put politics aside and provide relief to the American people. We expect to exhaust the $20 million allocated for rent and mortgage relief next month, just as an example here at the muni level, and can no longer accept applications as a result. Only Congress has the resources to provide relief to struggling businesses, workers, and families. We don't know exactly when we'll cross the finish line, but we can decide now to cross the finish line strong and knowing that we did what we could to protect the vulnerable in our community and preserve our hospital's ability to serve us all. We can do it. As you contemplate extending the emergency declaration, this is what I commit to you and the people of Anchorage. Thank you, Mr. Chair.
Thank you, Madam Mayor. Next, we'll have a brief comment from Mr. Weddleton to update us on some of the work which was discussed at the October 13th Assembly meeting.
All right, thanks. So working with Assemblymember LaFrance on bringing into our city code much of what we've been seeing through the emergency powers. And emergency powers are in our federal and state constitutions and our city charter for good reason. You know, things happen and they have to be responded to quickly. But early in this event, back in the spring, we said, well, what are health emergencies? You know, what can we do with that? And we actually had an ordinance that set some
Apologies
parameters.
for interrupting. Could you speak? Thank you.
That set some parameters on you know, how we would react to a health emergency. And in the 8 months since, we have learned oh so much. And so we'll be looking at more of that. And some of the things that I know you're all thinking and that we hear frequently and we're thinking ourselves is, you know, well, what would trigger it? What would trigger an emergency? And ultimately, when do we know it's over? You know, what would be the, you know, final thing to say, okay, we're done with this? So we're working on that. We don't have anything to show yet, but it's a work in progress. And hopefully in the next month or so have something that, you know, will give more certainty and bring more into the legislative side, you know, the various responses to a similar kind of emergency. Thanks.
Thank you. All right. So for testimony on public hearing items, please direct your comments to the Assembly or the Chair and not to anyone personally. Personal attacks are not appropriate. For public hearing items, your testimony must focus on the topic, not other items or subjects. I will, as Chair, work to maintain decorum at this meeting and ask for your assistance. With that, we're going to start with the phones. We're going to do 3 on the phones, 3 in person until we're done with our phone list. So first we have Julie Sape.
Good evening, this is Julie.
Hi, Ms. Sape. You are here with the Anchorage Assembly. I need to do one quick thing, and then I'm going to invite you to do your testimony for 3 minutes. So we are on item 4A, resolution number AR 2020-398, a resolution of the Anchorage Assembly for a 6th extension of the declaration of civil emergency issued by the mayor of the municipality of Anchorage on March 12th, 2020. There is also an S version of this item. Okay, with that, sure.
Hello?
With that, you have 3 minutes. Welcome.
Okay. Thank you. Thank you, Chair Rivera. Members of the Assembly, my name is Julie Sape, and I am President and CEO of Visit Anchorage. As you discuss the extension and consider policies to help mitigate the impacts of COVID-19, I was encouraged to share this information on what many tourism businesses are thinking. Earlier this month, we fielded a short poll before tourism companies in the community. We had 140 business leaders respond. It was not scientific, but we feel it is a large enough slice of the community to be insightful. Based on these responses, there is strong support for policies requiring mask usage, social distancing, and other best practices for their business, with 82% agreeing or strongly agreeing. These respondents are tourism-centric businesses in and around the municipality. And when we looked at just those responses for businesses within the municipality only, that support increased to nearly 90%. I want to acknowledge that doing what is right can still hurt the bottom line. As you know, there's already been a lot of damage done by the pandemic, and the social distancing measures in particular are very tough on some of our businesses, but they recognize that we are reaching a point where these type of measures can help in the end and decrease the length of our pain. So the sentiment of this informal poll also mirrored a lengthy discussion by members of our board of directors, and I think it is also in line with what you have already heard from others in the hospitality industry, that if we want to see our local businesses come through this and to flourish, we need to take the necessary steps now. Measures to stop the spread are needed, as are policies that can help our businesses keep their staff healthy, keep their customers healthy, keep their doors open, and provide help in asking their customers to wear masks for those who are unsupportive. Looking beyond our own borders and later into summer and spring, we've also been watching consumer and traveler sentiment. They are watching communities and destinations, and they are supportive of those communities and are planning trips around those communities that seem to be taking all of the measures to get rid of COVID more quickly. Thank you.
Thank you for your testimony. Before I go on to the next person on the phones, just a quick reminder to folks in line, if you could please make sure that you're physically distancing in line. We're going to get to everyone, so don't feel pressured to stand in line the entire time. Next we have Bill Pop.
This is Bill.
Hi, Mr. Pop. This is Felix Rivera. You're here with the Anchorage Assembly. We are on public testimony for AR 2020-398. You have 3 minutes. Welcome.
Thank you, sir. My name is Bill Pop. For the record, I'm President and CEO of the Anchorage Economic Development Corporation. I'm calling in tonight to offer our support for the renewal and passage of tonight's business and renewal of the emergency orders. We are seeing significant issues that concern us regarding workplace safety from both owners, managers, and workers alike in the many businesses that are members of our organization, as well as other businesses that we interact with with our sister organizations such as Visit Anchorage that just testified. Workplace safety is a great concern to all of them, and this emergency order renewal would give the tools necessary to continue to try and find the path forward that we are working all together toward, to trying to get both our community through safely and our economy through as least damaged as we possibly can. The issues of masks, social distancing, and controlling group sizes and things like that, while in the initial phases of the COVID-19 did cause quite a bit of havoc and a lot of consternation in the business community, as we have learned more and as we have witnessed more, I can share with you that any number of businesses now recognize the need for the restrictions that we are putting in place in an attempt to keep their workers safe, their customers safe, and their businesses open, though at a restricted degree. There's been a lot of collaboration with the new administration through the Economic Resiliency Task Force and other business organizations that Mayor Quinn Davidson has met with. There's a lot of discussion about how we can mitigate the impacts of needed emergency orders to the degree reasonably safe, and we believe that keeping this emergency order in place is a key underpinning to maintaining that ability to move our economy forward. Many of our are in the healthcare community, and the fears that they are expressing to myself and to other members of our Economic Resiliency Task Force, as well as to our fellow business organizations, concern us deeply. When a local hospital rents a mobile morgue, that's kind of a sign that nature gives that there is trouble on the horizon. This emergency order is very, very important to the future health and safety of our citizens and to the future health of our economy, and we ask that you support it tonight and do the extension as presented. Thank you, sir.
Thank you for your testimony. Next on the phones, we have Melinda Taylor.
This is Melinda.
Hi, Ms. Taylor. This is Felix Rivera. You're here with the Anchorage Assembly. We are on public testimony for AR 2020-398. You have 3 minutes. Welcome.
Thank you. Mayor Quinn Davidson, Chairman Rivera, members of the Anchorage Assembly, thank you for the opportunity to speak before you tonight. My name is Melinda Taylor. I'm a former Assembly member representing East Side. I'm also currently the Communications Director for IBEW Local 1547. I am testifying in support of the extension of the declaration of civil emergency regarding COVID-19. As per recent information from the Alaska Department of Health and Social Services and the Office of Governor Dunleavy, the cases of COVID-19 have increased exponentially, representing a threat to the health and welfare of Alaskans. Members of the Anchorage medical community have cried out for help, asking the public to take the necessary steps to mitigate the spread of this disease. I believe an extension of the declaration will allow the municipality to work with the medical community and other partners to take a thoughtful, strategic, science-driven response to fight this threat to public health and safety. Thank you for your time and service to our community.
Thank you for your testimony. All right, we're going to go ahead and switch to in-person. Welcome. It's the yellow button. There you go.
Are we good? All right. Okay, well, let's start with, isn't that interesting, your first three that testified, Julie Sape, Bill Pop, and Melinda Taylor. Do you really expect us to believe that that was organic and not planned?
Could you state your name for the record?
Bernadette Wilson.
Thank you.
I will also point out to you that the mayor, when she just gave her report, stated that only the federal government could help in this case. Guess what? The federal government attempted to help, and this body took federal money and used it to buy homeless shelters. And yes, you can walk through your semantics, how you actually pulled money from first responders, and technically we didn't use that money for homeless shelters. We know darn well what you did. We're not stupid. I will remind you that in regards to this emergency order, several of you within this body stated the last time that this got extended that you would extend simply with the intention that the municipality by the end of November would have a plan to go forward. That's what you said the last time. This is a virus. Yes, it's going to spread. Yes, the more you test, of course, people are going to come up positive. But let me tell you this, I have two ideas for you. Here's the first one. You give up your paychecks. If you want us to take you seriously, give up your paycheck. The mayor can give up her pay increase, and you go give it to all those employees that have lost their jobs or those business owners that have closed their doors. Second of all, as far as your emergency order and requiring people to wear a mask, I want to see a disclaimer or a hold harmless agreement that I want every single member on this body to sign, saying that if someone does pass out at a business, or if there are long-term or any health effects caused to a 5-year-old, a 15-year-old, or a 75-year-old, that you will take full responsibility. I'll be happy with that. Talk to your attorneys. Let's get you, any one of you can introduce an ordinance to bring forward a hold harmless type of agreement if you're going to force everyone to wear masks. And you know what? If there's no risk, then you don't have to worry about it. No big deal, right? You're just covering your bases. I want to see it. And finally, I will leave you with this thought. You have got to take a reset, and you've got to take time to reflect. Our forefathers came to this country, the death rate was nearly 50% when they came over. Nearly 50%. But they came for the freedom of religion. They came to live an American dream. That American dream right now has been squelched, not because of an outbreak, but because of you. The people who thought like you, guess what? They're not Americans. They still live over in Great Britain. Get back to where we came from. Thank you.
Thank you for your testimony. Welcome.
Good evening. My name is Brenda Lutz, and my goal in testifying tonight is to consider rephrasing or striking some paragraphs in the sixth extension of the emergency proclamation. Real quick, to piggyback on the presenter before me, one question I had for the Finance Committee that worked today, there was a statement in there that said you can tax some of the emergency orders. I think for the Assembly members, it might be helpful to expand on what that means at some point in the media. But again, my goal tonight is to talk about rephrasing some of the proclamation. So there is a line in the proclamation that states until a vaccination or effective treatment is found, and we just heard the mayor state something about vaccinations coming maybe in the next couple months for high-risk individuals. I think we need to be realistic about what that means. I served in the military, and I remember my third day of basic training receiving 12 vaccinations that my family didn't receive until 6 years later. So strike anything about a vaccination. And then effective treatments. We have effective treatments currently. So my point there is just maybe reconsider the verbiage. Secondly, there's some, and maybe this is, I don't know if it's in the new proclamation, some verbiage about working with the Anchorage School Board. The Anchorage School Board is like a chicken and egg situation. You both are getting your information from the same agencies, and I'm not sure that the Muni should receive their information from the school board because the school board is acting based on the municipality's decisions with the emergency orders. Finally, in speaking to the mayor, I know that the mayor appreciates that every time she speaks, business owners in Anchorage, their employees, parents, and basically all citizens at this point are holding their breath to find out what shutdown is going to happen next. Thankfully, there wasn't a shutdown this last time. However, my plight tonight really is as a person who's a veteran of the Alaska National Guard, also someone who's certified and worked in several FEMA incident command system disasters and someone who works in the project world, there's one thing that all three of those have in common, and that is a battle handover or a response handover, or at some point you do have a disaster recovery handover, and I think as Mr. Weddleton attested to tonight, I think he and Mrs. LaFrance are working on that type of plan. I encourage you to include that type of handover because we do need to move this incident into operations in Anchorage. Thank you.
Thank you for your testimony. Welcome.
Hi, my name is Claire Tilley. I live in Chugiak. I am from Australia and I moved to Alaska for the freedoms that are famous everywhere around the world that are not available to people in places like Australia. And I wanted to first address, I am an American citizen and a voter, but I first wanted to address the misinformation that's been spreading about what's going on in Australia. My children and grandchildren live in Perth, which is the capital of Western Australia. They have not worn a mask for one day. There has not been one day of mask mandates, and my grandchildren have not had one day off school. They did have a few weeks of a shutdown right at the beginning like we did to flatten the curve and have since gone back to normal. My daughter has opened a gym for Brazilian Jiu-Jitsu since that time, opened in August and has been running at full capacity since then with no adverse effects. Secondly, I would like to address the mask mandate. I personally find wearing a mask very distressing. It affects my breathing, it affects my personal health, it affects my immune system, and I find it very hard to believe that you as a body have the right to tell me that I am forced to wear something on my face that affects my own personal health. Thank you.
Thank you for your testimony. Next, we're going to move back to the phones, so 3 more on the phones. First, we have Dave Reeves.
Hi, this is Dave Reeves with the International Brotherhood of Electric.
We'll go ahead and come back to Mr. Reeves later. Next, we have Nicholas Papakostas. And just really briefly to the folks who were being rude and laughing in the audience, anyone in the municipality of Anchorage has the opportunity to testify before us, so I would ask that we be respectful of everyone. Hi, Nick. This is Felix Rivera. You're here with the Anchorage Assembly. We are on public testimony for AR 2020-398. You have 3 minutes. Welcome.
Thank you so much for giving me the opportunity. My name is Nicholas Papakostas, and I'm an emergency medicine physician working in Anchorage, and I'm currently the vice president of the Alaska chapter of the American College of Emergency Physicians. Our organization has members throughout the state, and I strongly support extending the COVID-19 emergency declaration. I'd like to thank the Assembly for their efforts during the COVID-19 pandemic. This is a public health challenge unlike any before, and your efforts to keep the city of Anchorage safe are appreciated. The COVID-19 pandemic, which led to the emergency declaration last March, is very much still ongoing, and as such, it makes perfect sense to extend the declaration. Indeed, COVID-19 currently is a rapidly growing threat, and we each day cross into higher risk conditions if trajectories continue. The Assembly needs the ability to nimbly and decisively respond to changing conditions. I realize it's hard for those who don't work in the hospital setting or haven't personally been affected by COVID-19 to understand how dangerous it is. I'm here to bear witness that for some people this disease is debilitating with lasting health effects, and for some it is deadly. In Alaska, we have been fortunate to see how the pandemic is unfolding elsewhere and hopefully take steps before we get to those levels. North Dakota has taken the extraordinary step to allow healthcare workers who are infected with COVID to continue to care for patients. Utah has relaxed their nursing ratios so that each nurse is responsible for caring for more patients and have created a temporary license to allow nursing students to work more independently to meet the vast need. Anchorage's healthcare resources are currently very stressed. Each day, many staff are unable to come to work because they either have COVID-19 or have been exposed and are required to quarantine. This limits the number of open beds to care for patients. Often there are physical beds available but no staff to care for them. In this way, the dashboard statistics can paint a rosier picture than reality. We are not any different than anywhere else in the country. We are just as vulnerable, and so far we have not had to relax our standards of care and have not had to make hard decisions about who gets care and who does not when resources are exhausted. However, if we do not actively take steps to limit the spread of COVID-19, it's conceivable that we could face with those eventualities. In conclusion, I strongly encourage you to vote tonight to extend the emergency declaration. I also recommend approving the longer of the two declarations. There is no reason to believe that the pandemic will be over in December. Indeed, I suspect the Assembly would have to discuss extending it again in January. Unequivocally, masks can limit the spread. They protect you from getting COVID-19 and protect you from spreading it to others unknowingly. Physical distancing works. Keeping gatherings small works. Everyone is tired. Everyone wishes we could get back to normal life. Free to visit businesses unmasked, see each other smile, gather with friends and family to celebrate holidays, birthdays, and weddings, but we need to stay vigilant. Fortunately, vaccines are closer on the horizon, which will gradually allow us to return to normalcy, but we still need to work hard to prevent a disaster until that time comes. Thank you very much.
Thank you for your testimony. One more person on the phone list.
May I ask you a question, sir?
Oh, sure. Apologies. Mr. Whittleton.
Is he still on?
Can we go ahead and ring him back, please?
Did you want to go ahead with someone else in the meantime, or try him real quick?
That's not how the system works
Okay.
yet. Yet.
Hello?
Hi, Nick. This is Felix Rivera. Apologies. One of my colleagues had a question for you. Mr. Whittleton?
Oh, thanks. We get quite a bit of, contacts, emails, and talking to people about this stuff, and I think you had some valuable perspective. And one thing is that, the medical health capacity, I mean, we expanded so we could use the Alaska Airlines Center. I think the hospitals expanded some of their capacity and so on. But, my understanding is that the adult ICU beds has kind of ultimately been the constraint. And I wonder if you could address that. Is that true? Can we get more adult ICU beds and not have that as a constraint? And is the, kind of where we're cutting it close now, is that just based on what we normally see this time of year anyway? Thanks.
So the ability to care for more ICU patients is not limited by physical space. It's limited by qualified staff to care for them. So there are times that even though the dashboard has said that there are beds available in the city and in the state, I've been at work, and instead of having patients in the ICU where they are getting cared for, they're still boarding in the emergency room and not able to get an ICU bed. So it's because we don't have enough staff to take care for them. So even if we had more physical space, we couldn't spill into, the Alaska Airlines Center, one of those places. So there's not a place to take care for those patients. I would say that, the healthcare system in the United States, and Anchorage is no exception, is almost always running close to capacity because, we're a system that depends on getting paid for services. And so each year, it is tough. We are close to full. But however, we have an additional threat. And so at this point, every excess case, of COVID-19 that needs to be hospitalized is above what we're normally experiencing. So I know people, say, to look at the numbers and say, that's not so many people. But when you're running a healthcare system that's close to the max all the time, those extra few cases or 100 cases, and increasingly, and now we're in like 120 cases hospitalized in the state, tax the healthcare system even more.
All right. Thank you.
Thank you.
Sure.
And I actually have one more
You're
question
welcome.
for you from
Of course.
Mr. Constant.
Thank you. On that same line, actually, we've had a number of people write to us and assume that we could simply recruit an array of traveling health workers that would come to Alaska and save us. Can you speak to the reality there?
Absolutely. So we do, Alaska in normal times relies heavily on out-of-state workers. We work through different staffing companies that, ask, nurses and doctors to come to Alaska to work for part-time jobs to fill need or fill staff. The thing is that everywhere in the country is looking for extra people right now, not just Alaska, and we are geographically very isolated. So all those staffing companies we normally reach out to recruit, they have no nurses to send us, no doctors to send us, no respiratory therapists to send us because other places are bidding on those contracts and getting them in front of us. And so when you're competing for a small pool of resources and you're far away, there's a good chance you're not going to get them. And so I don't think we can rely on that in Alaska to meet our needs because, COVID-19 is surging all over the country, not just here. So we can't fill our staffing needs based on pulling from out-of-state workers at this point.
Thank you. Thank you for your testimony. All right, so now we're going to go to the third person on the phone list, Mr. Dustin Sherman.
Hello?
Hi, Mr. Sherman. This is Felix Rivera. You're here with the Anchorage Assembly. We are on public testimony for AR 2020-398. You have 3 minutes. Welcome.
Thank you, Mr. Chair. Give me 1 second. Let me pull up my notes. Get through real quick. All right. First of all, I want to I oppose Resolution AR 2020-398, and many of you may wonder why. Actually, my wife right now is actually in Providence Hospital, fighting for her life right now due to COVID. I myself have COVID as well. The reason that I am against Resolution AR 2020, can you hear me?
Yes, we can hear you.
Okay, sorry about that. Let me turn out, there we go. Okay, so the reason I'm against it is because, at the beginning of this, 8 months ago, back in March, you guys had prepared, as well as many other states had prepared, all kinds of different resources, like the airline center and a bunch of other things, and then whenever it didn't hit like you expected it to hit, you guys closed them all back down. There's a bunch of different things that I think that can be done that I don't think are being done. And unfortunately, right now with the ICU bed situation and the fact that we don't have enough doctors to take care of the patients, like your previous caller had said, we're kind of stuck. And the thing is it just seems to me we just keep kicking the can down the road without extra resources that we need to actually make it work. So what's the solution? Instead of continuing to keep having a declaration of civil emergency, we need to come up with solutions. Instead of just kicking the can down the road every time that we decide that we have to do, why not come up with better solutions? What about using doctors from other countries? I mean, it's just an option, an option. I mean, I know that we're isolated up here in Alaska, but we have neighbors right to our, we have neighbors in Canada. We have neighbors all over the place that would probably come over here and help us. I haven't heard any kind of mention of that. So, there's treatments and stuff like that are being done that are being very successful, but the fact that we're in this situation when we were at one time prepared for it completely blows my mind. We were prepared for it, and then we either shut it down or whatever. It's like New York and California with the medical ships that the Fed sent out there. They got out there, they never used them, and they sent them away. So what's the solution? I guess that's where I'm opposing this, is because we just keep kicking the can down the road without any solutions otherwise. That's all I got. Thank you.
Thank you for your testimony. All right, we're going to go ahead and switch back to in-person testimony. Welcome.
Yeah, my name is Robert Ruby. I'm not much of a public speaker because I don't work with the public, but this resolution that you did in March, all it managed to do was to disenfranchise a bunch of people that had worked, some of them their whole lives, for businesses, and they ended up leaving town broke, lost everything they'd worked for 30 years, while you guys are trying to save somebody. If you want to save people, your job should be to put the information out there that if you're over 65 years old, or you're fat, or you got a problem, or you smoke, or you got some other comorbidity, you need to stay out of the public. Not to mask the rest of the world and disenfranchise all these people that have went broke trying to live up to this expectation that you can do everything over a telephone or a computer. or take it out. You guys have abdicated your oath when you took the office that you're sitting in to uphold and support the Constitution of the United States and the state of Alaska. The Constitution doesn't say anything about a virus or taking away all my liberties so that maybe somebody else is going to live. And it's false. If they're going to die and they get this virus, they're going to die. And if they're going to die, if they get the virus, then they're going to die. We're all going to die. Taking away all the ability of somebody else to have a free life with this pie in the sky, we're going to mandate that the rest of you suffer so that we can say we're doing something. If you want to do something, tell the people that have the real chance of getting hurt by this thing to stay home or to get some kind of a special thing that they can wear, not that and not this. I'm talking about something that's going to keep that virus out. This ain't worth the powder and lead take to blow it to hell. And neither is that when it comes to a virus. I got a 2015 study on masks. And it was a CDC study. But you don't hear about it now because now it's all put the mask on. But back then they did a study on the 1918 plague when they tried to mask up and tried to put masks on people and tried to protect them. And the study said it didn't work. And it didn't work because the virus went right through that stuff. This is like a screen when it comes to a virus. Something that's 0.17 micron is going to go right through this thing. So my thing is to start going back to the Constitution and start doing what you got elected to do. You guys are representatives. We voted for you to represent us against them. But what you're doing is you're in cahoots with them. You've created an oligarchy that sits here and passes crap over and over and over again over the heads of all the people that put you in office. And it's time you're going to have to stop this madness. You know, all you're going to do is cripple somebody else's business. I know a guy that's lost his ability to operate his left leg because of this crap in March.
Thank you for your testimony, sir. So as a reminder to the public, I'm going to ask folks to not clap. It is disruptive for folks on the phone and folks watching online and on TV.
Objection.
Welcome, sir.
Hello, Chairman Felix. My name is Jason Agri. I'm here to find those around you who have the decency, who have the dignity to champion a fair and just course for the security and prosperity of this community. Those of you who believe in the Alaska Constitution, those of you who swore the oath to our Constitution as your compass on board of the Assembly or Mayor on the phone. I stand here before you as an artist. I paint here. I'm born in Anchorage. I care deeply about this place. I'm here to advocate on behalf of the 288,000 people in this town that you are the mayor of. You see, the Alaska Constitution is very, very clear. Article 1, Section 7 of our Due Process Clause says that no person shall be deprived of life, liberty, or property without due process of law. The right of all persons to fair and just treatment in the course of legislative and executive investigations shall not be infringed. This means that our right to a fair investigation that justifies your executive emergency powers shall not be infringed. Therefore, I ask for you, those amongst you to stand up and be a champion for our constitutional due process. You are all politicians, so therefore I ask you to convene a panel, an independent committee, to act as your advisory body, free from political coercion, a panel free from political influence, a way for you to save face out of your due process violation. This started on March 12, 2020 by the Berkowitz administration. An independent, fair investigation that justifies your emergency powers was never, ever conducted by this administration. I therefore ask this Assembly for the following: a motion to convene an independent blue ribbon panel free from undue political influence to investigate an issue of finding on the nature and cause of the medical, scientific, and legal controversy of these administrative COVID-19 emergency powers. And I also sternly admonish you hereby to terminate your emergency powers in absence of a fair and just investigation, because you are committing the illicit, wrongful act of denying 288,000 people in this town their constitutional due process rights. This body should terminate its COVID emergency powers and stop violating our due process rights, and solicit applicants for a blue ribbon panel to investigate the medical, scientific, and legal controversy as to why we have been denied a fair and just investigation and have been made to suffer this due process violation.
Thank you for your testimony. Welcome.
Thank you, Assembly. My name is Dia Madison, and I'm a small business owner in Anchorage, Alaska. I own both commercial and residential properties here as well. The Mayor and Assembly have taken an approach of government mandates and shutdowns in an attempt to deal with the virus. In the beginning, there was a lot of unknowns, and I'm sure everyone was trying to do what they thought was best. We had a large hospital overflow built, and it was taken down because we did not use it. And the previous caller mentioned that hospitals are in the business to make money, so it does them well to have full hospital beds. So it doesn't really do them any good to provide more hospital space and not have a sense of emergency and not extra funds for COVID. These mandates were created on the basis of social distancing and reducing the spread, and they were completely illogical. You could attend a food truck event and an outdoor market with no attendance limit, but not an assembly meeting or church, even if social distancing was possible. You could shop for all items in Target, Costco, and Walmart, including clothing and what you guys deemed non-essential, but you could not buy clothing from my small business. You could eat in a tent that was fully enclosed and had forced air, but could not eat inside a restaurant. If the masks work, then everything should be open. For 8 months, you have continued to push further mandates and restrictions without any solid evidence it will work, and so far, no actual local success or supporting data. The city of Anchorage has been your social experiment, and there is no performance report to show this is actually working. Anchorage has some of the most restrictive mandates in place, yet, based on population, Anchorage has the second worst infection numbers. The masks don't work, and the mandates don't work. The purpose of this meeting is to allow the constituents to feel they have been heard while you are considering extending to a mayor that is not legally holding her office more power. Not only should the emergency order be terminated based on the data that the mandates don't work, but they should not be given to a mayor who is not elected by the people. Further, as a taxpayer, I am currently paying full taxes and receiving significantly less services. You may have forgot while you were spending the giant fund of money sent to us through the federal government called CARES that your constituents had immediate and direct needs. I am sure that thousands of employees that have lost their jobs and small businesses that are permanently closed because of these unconstitutional shutdowns are not pleased with you for spending millions of dollars on trails, pet projects, and buying buildings that will not be used for over a year for the ever-growing vagrant population. Your complete disregard for the voice of your constituents is shocking and disgusting. By continuing lockdowns, you are complicit in continuing the rise in abuse, suicide, job loss, depression, loss of local businesses, loss of population and tax revenue, long-term damage to the hospitality and tourism industries, and more. As a resident of Anchorage, as an Anchorage business owner, as an Anchorage employer, I am asking that you remove the emergency orders and rescind all mandates. Allow the people to make their own healthcare choices.
Thank you. So again, I'm going to remind the audience in general to please refrain from clapping or any other disturbances. If I have to make repeated warnings to specific individuals, I will do so. And then if individuals cannot keep up with the rules of decorum in this chamber, then I'll ask them to leave the chamber. All right, so we're going to go ahead and move on to phone testimony. So next we have Elaine Hedden.
Hello, this is Elaine.
Hi, Ms. Hedden. This is Felix Rivera. You're here with the Anchorage Assembly. We are on public testimony for AR 2020-398. You have 3 minutes. Welcome.
Thank you very much for taking my call. And I just wanted to provide testimony and to just ask some questions of those that it's appropriate to ask to. I have recently discussed with a person that I would like to leave unnamed, and I would like to leave the hospital unnamed. And this person was sharing with me that the particular department that this person works in, that when a patient is admitted, that they receive an automatic positive COVID case. They're automatically positive. And they may not be coming in with COVID symptoms. They may be coming in with cardiac issues or respiratory issues, not necessarily COVID symptoms. And unless they get tested to see if they are positive or negative, that by default stays as positive. So I'm questioning the overall cases of positive. The virus is real. I'm a physical therapist. I deal with patients on a daily basis, and the virus is very real. The issue that I have is what are these numbers of cases? Where are we getting these numbers from? And if there's any kind of independent body that does any kind of reviews. And that's basically what I wanted to ask. And then also if there's any way we can find out if there's any kind of monetary incentivization for a positive test. So these numbers we don't know, and there's just a lot of questions that are not being asked, or if they are being asked, are not being answered. And thank you very much for your time.
Thank you for your testimony. Just as a reminder to the public, these types of questions are typically, if members decide to bring them forward, are addressed during deliberation. Welcome. Oh, excuse me. Moving on to Brittany Tompkins.
Hello, this is Brittany.
Hi, Ms. Tompkins. This is Felix Rivera. You're here with the Anchorage Assembly. We're on public testimony for AR 2020-398. You have 3 minutes. Welcome.
Hi, I'm asking the Assembly to not extend the declaration of civil emergency. The current mandate puts businesses in the place to police patrons regarding whether or not they have to cover their face. Then places like my kids' gymnastics have to enforce the little kids that run around inside with masks. If I take my kids out of gymnastics, because I do not agree that it is safe to run around with masks on, then I'm vilified for taking away money from a local small business. I have family members with medical conditions that keep them from being able to wear a mask. These medical conditions are very serious because their personal doctor has warned them many times not to wear a mask due to the risk of infection that could cause blindness. These emergency orders are forcing businesses to unjustly discriminate against people with medical conditions. The entire world has been diagnosed with the virus. The prognosis from leadership is grim. The prescription is to shut down our lives, but those who seek a second opinion, or even a personal doctor opinion, as we've been taught to do, have been vilified by the mainstream. By our own Assembly members and acting mayor, I've been told just wear a mask, without anyone asking me and for my personal medical information. In the past, I've been told to seek medical information from a certified doctor, not the Assembly. So my question is, if someone does get a negative side effect from wearing a mask, are you liable? According to Dr. Fauci, the cycle threshold for a PCR test should not exceed 35 cycles, because beyond that, the test is showing positive for dead nucleotides. The state of Alaska uses the cycle threshold 37 with 40 on the backup test. That is a factor of 1,000 times more sensitive than the cutoff recommendation by Dr. Fauci. This contributes to the healthcare shortage because we have healthcare workers sitting in quarantine who should be working, not to mention cases that aren't. For no other virus in history, we have diagnosed someone with an illness without actual symptoms, With the highest testing in the country, it's no wonder that we have a case-demic. People have the right to make their own informed medical decisions, and I stand for freedom of informed consent. Thank you.
Thank you for your testimony. All right, we're going to try Mr. Reeves one more time, and then that will conclude our phone list. Okay. We're going to go ahead and go back to in person. Welcome.
Is it already on? Yeah. Good evening. I'm Dr. Michael Hannafin. I'm a decorated Air Force veteran, small business owner. I hold a bachelor's degree in science, a doctorate in chiropractic, and I'm currently a candidate for my doctorate in education. I oppose the extension of the order based on several factors. First and foremost, it's against the Constitution. It's an abhorrent act by our legislative body to violate that. Continuing on to the CDC website, which you guys love to quote, the goal of community mitigation on the CDC website is emphasize individual responsibility, not mandate it, emphasize it. Empower businesses, schools, and other settings to implement appropriate procedures. You need to prioritize the settings for critical infrastructure services, which you guys have had 8 months to work on, and you have come up with nothing as a plan to move forward. The emergency room doctor that spoke should have had a plan. If you don't have a plan for this, then you're going to run scared every single time and come to the conclusions that you guys have. It also says that you need to minimize the disruption to daily life to the extent possible to ensure the access to health care and other essential services. There is not access to health care. There's doctors that are doing telemedicine that should be in-person visits. As a chiropractor, I'm fortunate. All of my stuff has to be in person, and I love seeing my patients every day. But even my practice has suffered a 30% decline in patient visits because of the mandates and because of the fear-mongering that this assembly has done. My second point is the fact that the PCR test that's being done, as the previous caller admitted or spoke about, you cannot cycle this thing more than 30 times and have it be legitimate. The PCR test was never designed to diagnose a disease to let you know you're ill or that you're contagious. This is the research. Your doctors that are advising you know this. When the PCR test was designed, it was to let you know something was there. They can test for anything. It just signifies that it's there, not that you're sick. With my remaining time, I went through all 9 studies on the Department of Health's website, your own website, okay? All 9 of them. Not a single one was definitive that masks work, because they don't. You cannot hide from a virus. It's out there. It's a May. This one used a model. You had a futuristic one on there too from 2021. That was interesting. So, children under the age of 10, not testing positive, not an issue. Schools should be open for at least them. That's my testimony. I oppose this mandate.
Thank you. I have a question for you, sir, from Ms. Allard.
Hello. Thank you for your service. Much appreciated. Can I get your name again, please?
Dr. Hannafin.
Thank you, Dr. Hannafin. So I have been taking some notes tonight, and I wanted to ask you a couple questions if you can answer. So they say there's a large number of asymptomatic carriers. There are also a large number of people that will continue to test positive after they are no longer contagious. Have you heard that before?
Yes, ma'am.
And why did you hear that?
Through the research that I did, the additional research that I did, when we look at asymptomatic carriers, the study that I reviewed was from both Italy and from Iceland. They were the largest cohort studies that had have been performed to date in regards to COVID, and they demonstrated that somewhere between 46 and 87% of those tested will be asymptomatic. So by that means, the spread of the virus is going to happen, and many, many people are not going to show signs of symptoms. The benefit of that is that they're not impacted by those symptoms. They're just positive. But the PCR test will also show positive for a coronavirus. There is a human coronavirus. That's going to show up on a positive test. That's the common cold, by the way.
So Dr. Hannaford, no matter what we do, and if people keep testing over and over and over, if they're positive, the likelihood of them not being contagious, but always positive, it's there. That's a fact,
It's
a
very
medical
high.
fact.
It's
Okay.
absolute fact.
So I'm going to ask you a couple other questions, and just a simple yes or no. Did you know that Alaska is 49th in the country for COVID deaths per million? It's pretty good.
Yeah.
Also, we're 29th for the total case per million, which means we're either the death rate is low because of the demographics, that we're younger and we're more fit, or we have a less virulent strand. Can you explain that, what that means about the strand, so I can understand it a little better?
The flu virus is a great example. Some years the flu is much more virulent, and it has a lot to do actually more with stress levels of the individuals than it does about the actual strand itself. If we continue having these lockdowns and these fear-mongering and these misrepresentations of the actual science, then you weaken people's immune system. You don't allow them to exercise. We have not seen anybody from this body or from the doctors that are advising you advise on supplementation that could be beneficial, like vitamin D, vitamin C, and zinc, all been proven to help not cure it, not avoid it, but at least boost the immune system enough that you have a better chance of survival, even though it's 99.95% survivable.
And then my last question to you is, we all have our mask. Do you talk to your friends and other people that say every single time they have their mask, they absolutely wash it, or they put a new one on, or they don't touch it throughout the day and leave it on their face non-stop?
Okay, that was my biggest thing in the very beginning of this, is the fact that although we'd love to think that everybody knows how to wash their hands, we have to give them instructions, but these masks are absolutely hanging in everybody's car for days. And they're picking up everything coming in and out of that car. So the chance of actually exposing a patient to something more deadly is higher by wearing masks that people cannot stand on their face and touch and cross-contaminate. And then in California, they said, take your mask down, take a bite of food, and put it back on. What do you think they're doing? They're literally cross-contaminating with that mask every single time you touch it. Now, I'm actually really impressed. Very many of you haven't touched your mask tonight. I can't stand it. You've done a great job too until now.
Thank you. Moving on, I have Ms. LaFrance.
Thank you, Mr. Chair. Thank you for coming and for testifying tonight. I'm sorry, I missed your credentials. You're a doctor of chiropractor?
Yes, ma'am.
And then you are working on a PhD
I have in education.
in education. Okay, congratulations, thanks. I wanted to be clear, I understood what medical credentials you have. Thank you.
Thank you. Mr. Constant?
Yeah, thank you. I've been having a little hard time hearing that testimony. I'm trying to understand how much virology this speaker studied in medical school. Thank you.
I'm sorry. Could you repeat that one more time, Mr. Constant?
Oh, I heard him just fine. And he responded to my email, the first testimony that I gave, as you, Ms. LaFrance, so rudely put, my medical credentials. Just because I'm not a medical doctor does not mean that I don't have an education in, Mr. Constant, virology, immunology, histology, biology, biochemistry. These are all standard classes that I take, and I graduate with over 300 credit hours more than the average MD in this town. So don't question me on my education. It's all included, including virology.
Thank you. Again, I'm going to ask folks to not... So I'm going to go ahead and just give a final warning to you, Mrs. Hill, and to you, Mrs. Wilson. Otherwise, I'm going to ask folks to not be hooting and hollering, please, because that's not helpful to our process. Ms. Allard?
Thank you. So my last thing is that, would it surprise you to probably know that you have more medical experience than anybody else in this room tonight?
I certainly do.
Thank you. And the other last question to you is, do you know of other doctors and nurses, as I do, that have refused to come forward and testify because they're worried about losing their licenses or the backlash from their superiors?
We have had several things put out by our board for the chiropractic community that have encouraged us not to talk about vitamins, not talk about things that will boost your immune system for fear of backlash. I put out a video, I refuse to delete it. I served my country to defend your right to do dumb things.
Thank you.
Thank you. Thank you for your testimony. All right, we're going to go ahead and move on. Welcome.
Hi, I'm Parker Reed, South Anchorage. Looking around at where the assembly members should be, I don't know if it's social distancing so they're not here. That's really troubling though that the full assembly is not here. If you guys are voting on such an important declaration, everyone should be here. That's really puzzling to me. We heard a little bit about the Constitution tonight. You guys were elected to uphold the Constitution. You're not doing that. We're going to remember that when election comes around again. It's intolerable that the elected officials are neglecting their basic duties. I have 6 kids. They are fearful of what's coming. They're not fearful about the virus. They're fearful about the leaders of Anchorage. They see how I react to the emergency declarations that you guys put out. They see anger and puzzlement in my face, and I got to tell you, I'm angry. You guys are considering voting on an amendment that was put forward by our last mayor in March. As I recall, he's not the mayor anymore. This is no disrespect to the acting mayor. She was not elected as the mayor, though. She shouldn't be able to declare emergency powers or whatever the verbiage is if she's not the actual mayor. She hasn't been elected to be the mayor yet. If that happens, that's one thing. Most of the testimony that we've heard tonight has been against continuing this emergency declaration. I'm very much against continuing it unless we talk more about solutions. We heard about solutions and that we haven't had a lot of solutions, and I know you all have day jobs, so I appreciate that that you're doing that and the assembly work, but I would love to see some more solutions. And then we can talk about some more emergency declarations. So that's all I've got.
Thank you for your testimony. Welcome.
Can you all hear me?
Yes, we can.
Okay, then I want you all to kind of wake up. I've been coming to these meetings ever since our rights have been trampled on by you folks. And I like to make responses via social media to keep people informed. You people have literally destroyed the city of Anchorage. So stand up, please, and take a bow. Come on. Oh. Okay, I'm sorry. I'm going to talk like this because I know they're not going to listen. Okay? My brother-in-law, I've done a lot of study on this. I'm not saying I'm as near as smart as that doctor, who, yeah, his IQ's higher than the combined IQ behind me there. So, in any case, so that's why I wonder why they could even question him. But I lost a friend on Facebook today. My brother-in-law lives in California. He's constantly telling me how great it is to wear a mask. I don't wear a mask. I wear a mask to come into places out of respect for their rules, but I don't say anything to those who wear a mask, and I don't expect them to say anything to me. I'm a vet. I've spent over 35 years in this town, and our health care used to be the best of all 50 states. And now it's been reduced to squat. I've had to wait 2 months, and I still haven't seen a doctor, and my arm is literally dying. And that's what these people have done to you. These people right here. I'm not going to say all of them, but they have a responsibility to us, okay? And as far as I'm concerned, Chicken Little up there, the sky isn't falling, okay? My brother-in-law, a response to a paranoid is what I entitled this. What it would be like, and it's not rocket science. Imagine a virus that attacked our bodies. God-given immune system kicks in, antibodies released to neutralize the virus and see that we're virus-free. I think if God intended for us to wear masks, we would have been born with them, right out of the chute, okay?
Thank you for your testimony, sir. Your time is up.
Pardon me?
Actually, I don't think we did. If you could state your name for the record, please.
Yeah, my name is Al Newman. Thank you.
Thank you. Thank you for your testimony. Welcome.
Good evening. My name is William Topel, T-O-P-E-L. Thank you, Assembly members who are present, Chair Rivera, and those who are on the phone listening. I'm opposed to AR 2020-398 and AR 2020-398S, and I will explain. This sixth extension of the Mayor's emergency proclamation from the original date of March 12, 2020 is predicated upon an increase in COVID cases, most of which are really test positives, and an increase in statewide deaths, which is truly unfortunate. However, Anchorage is not experiencing any piling up of dead bodies from the COVID infection, which would amount to a real emergency. Concerns about a shortage of hospital beds have already been considered when, number one, Providence Hospital has access to the UAA Alaska Airlines Sports Center, which has been closed to the public and closed to the UAA sports teams since March. And two, the Elmendorf Air Force Base Hospital could be accessed as well. So maybe our hospitals should hire more doctors and nurses and rehire the staff they laid off this summer and fall. After all, this is now the flu season. I want to see Anchorage overcome this infection just like anyone else. However, I question the effectiveness of what these mandates and lockdowns and quarantines on healthy people are doing. Now, according to public health experts, I should be dead by now. I am old. I am overweight. I'm actually technically obese now, thanks to being kicked out of the province cardiac rehab section in March and not being able to access the gym on a regular basis. Okay? And I've also had 3 heart surgeries. However, I'm here. That's because I listen to some naturopathic doctors, believe it or not, on the internet and talk radio, real credentialed naturopathic doctors. I take extra zinc. I take 1 selenium capsule a day, antiviral. 1 capsule oil of oregano. 10,000 units of vitamin D3. Up to 1,500 milligrams of vitamin C a day. A quart of diet tonic water a day. It has quinine in it. And I pray a lot. Here's my Bible. I'm out of time.
Thank you for your testimony. Welcome.
Good evening. My name is Vic Knott. I was involved in the original starting of this mandate of March 12, 2020 due to this COVID epidemic. I'm here to tell you that I am definitely against the extension of this mandate. I am a small business owner, been in business in Anchorage for over 40 years. Last year, my business had a gross of over $3.5 million. Currently, today, I am in the red for over $35,000. So my business has dropped almost $4 million since March. And like a lot of us old timers that have been in Anchorage for many, many decades, we are having to take and close our doors, which I've almost had to, and I'm at the brink of that. Selling what I have left after working in this town for 40 years. I've been in this town for 56. This used to be my home, but a lot of us old timers are done with what the Assembly has done to this town in the last 3 or 4 years. We are selling and we are leaving, just like they're doing in California. Maybe you guys are happy to see us leave, but there's going to be a point in time when there's going to be a lot of vacant properties in this town that are not generating any revenue for tax purposes. Not only property tax, but inventory tax, equipment tax, we pay that. People do not understand that, but it costs us a lot of money. And with these mandates, we are having to shut our doors. You're cutting your nose off to spite your face. I have a lot of friends that are seniors. They choose to stay home, which is perfect. But now with me being a small business, I am affected, and my business is about to close just like a lot of others in this town. And at this point, I would wish that all of you would believe in karma. If you don't, you're going to find out what it's going to be like in April. Thank you.
Thank you. Actually, I have a question for you, but before I do that, just want to do a quick mask check and ask folks in the audience, not you, sir, but other folks to please be wearing your masks. Okay, Mr. Dunbar, go ahead.
Thank you, Mr. Chair. I'm sorry, sir, I didn't catch, what was the name of your small business? It helps us to know which businesses are particularly struggling when we target CARES Act money.
V&H Enterprises, been in business since 1978.
And what kind of business is that?
Metal fabrication.
Got it. Thank you very much.
Thank you. Thank you for your testimony.
Thank you.
Welcome.
Hi, thank you.
My name is Russell Blacker. I am the owner of 2 assisted living homes, 24 residents, and we haven't had a single case of COVID, so we've taken the proper precautions and we've been lucky, I guess. And you know, you guys might applaud that, and a lot of people might, and I'm happy about it.
Sorry, sir. Could you move the mic up just a bit?
Yeah, but the other side of the coin is we've seen basically no new residents coming in. People are staying home, not getting the care that they need because they're afraid to come into an assisted living home. The residents we have on lockdown. We don't have visitors. They're getting depressed. Recently we just took one to the hospital. Your levels of risk of stroke double when you're isolated. So we're very concerned about the senior population, not just because of COVID, but because of these byproducts. And I'd just like to urge you to consider those other byproducts of shutting things down. I think there's definitely a lot of fear, and we want to help people the best we can, and I'm sure that's what you guys are trying to do. But let's not be myopic. I also have a wife that's a nurse practitioner. She's a pediatrician, and she works here in town, and at Latouche. She constantly feels conflicted. She's seeing lots of children that are very depressed and have issues. The education online is not up to par. And a lot of you, I'm sure, are Democratic or, whatever you may, but left, I guess. But it seems that the people that are impacted the most by these shutdowns are the poor and the minimum wage workers. They're the ones that are losing their jobs the most. People like me are generally okay, and I worry about them, all my employees, and people like them. And so there's just all these unintended consequences that really need to be considered. I mean, you look at the cities like New York, Detroit, they've implemented all these shutdowns, they've closed businesses, and they are now ghost towns. They've destroyed the cities. And I don't want to see that happen to Anchorage. We moved here for opportunity, and we don't want to have to leave, similar to this gentleman's business. And that's all I got. Thank you.
Thank you. I actually have a question for you, sir, from Mr. Weddleton.
Hi. So, it's interesting, your situation. So are there any mandates that directly impact your line of work, your business, your homes?
Well, yes. DHSS has put out mandates suggesting how we run our business if we want to keep our license. And so we have, quarantined and kept visitors out, and, the masks and all that. So yes.
Okay, and that would be like the state licensing?
Yes.
Okay. Okay. So, but so none of the city ones, but that's fine. So, it's interesting because, one of the things we hear frequently is, look, get rid of the mandates, get rid of all the control, just drop it. And people who are vulnerable, isolate. You guys stay, or they should stay. Let them worry about it. So essentially, I bet that's your people. I mean, the people that your customers are probably older and more vulnerable. So we got rid of all the mandates and so on. Basically, we're saying you need to do that. Keep your people in there and protect them. I mean, isn't that right?
Yes, I mean, we're trying to protect a vulnerable population, but these people are people just like you and me. And one of them in the back, Gregory, hasn't seen his wife in like 3 months. He's getting super depressed. I worry about his health. And so, yeah, you kept him out of COVID, but it's his life. You're killing his life. He hasn't lived. It's hard for him. So yeah, I do want to keep them safe. But I look at the recovery rates, even for the elderly of this disease, and to me, the costs are just so astronomical, especially when you consider all of the other people that aren't elderly that are being impacted. Yes, it might make sense to keep some precautions in place, but I don't believe in shutting down businesses or keeping children from getting educated. Yeah, those are my thoughts.
Okay, no, that's helpful. And I think the state rules we don't really have any impact on. I mean, I think the mandates for your business don't come from the city. But that's good. I didn't know you guys had any COVID-related constraints. Thanks.
Yeah.
Thank you. Thank you for your testimony. Before you come up, sir, I'm going to do one more mask check and ask that folks please be wearing your mask, and thanks to everyone who has been wearing their mask. And again, just as a reminder for folks who don't remember the rules, I don't have the resolution in front of me, but I will call for mask checks periodically, and if there are folks who aren't wearing masks, I will ask them to leave their chamber if they are unable to wear a mask. Welcome, sir.
I'm going to take my muzzle off. My name is Louis Imbriani. I'll be speaking with you guys tomorrow. I was granted time on the assembly agenda. I wanted to talk about a couple different things. I'm 28 years old. I've lived in Anchorage my entire life. Just leaving briefly to go out of state and participate in sports and come back. The first two people that spoke, they talked about personal responsibility. They talked about businesses not being able to or not wanting to enforce the different mandates, the masking, the social distances. By not allowing us to make those calls on our own and putting forth these emergency declarations, emergency orders, you're taking away that personal choice. The personal choice that allows us to dictate and do things how we see fit. If I'm running a business and I want my employees to wear a mask, they'll wear a mask or they'll go home. If I have a customer that comes in that doesn't want to wear a mask and I feel so strongly that it's needed, that customer can go shop somewhere else. They can go eat somewhere else. I know that businesses are struggling and people are struggling, but when we force the close downs and force people to limit how many people they're hiring, then we're going to put people in an even bigger bind. I worked Department of Corrections, and I walked through the Sullivan Arena. I was lucky enough to take a tour of that place when it opened and while it's been continued to run. And when I look around there, I see a lot of people who do need help, who are getting help, but they are losing out on the opportunity to get those entry-level jobs because of these different things that are being shut down. When I try to look for somebody who's a convicted felon to help them get a job, I'm going to be looking at the food service industry. I'm going to be looking at the hospitality industry. They fill those roles. They wash the dishes. They bust the tables. They clean up after everybody else goes home. They work those jobs that not everybody wants to go work, but the people who are willing to go out there and do it, they do it. And when we shut things down and we limit how many jobs somebody can offer, we are taking away those opportunities from the people who want to get help and the people who want to better their lives. And that is all that I have for you, and I strongly oppose this resolution 2020-398. Thank you.
Thank you for your testimony. Welcome.
Hey, thanks. Howard Hunt, born and raised on the east side, been in town a long time, since 1965, come and gone a good bit too as well. You guys got a tough job in tough times, but I think that kind of characterizes Anchorage. Congratulations on 100 years of municipal governance. Here we are. Looking back then, you can kind of see where we're headed now. But I think Alaskans, and particularly Anchorage'ites, have always been tough. I'm opposed to any extension of the resolution. I would refer you to 5 key points here I'd like to make. One is, I think if you're going to focus it next, focusing on guidance on wellness. What I mean by that, help educate the population more, let them make their own personal choice on things, talk about social distancing, talk about washing hands, and if you're high risk, stay home. You got a lot of other options to you out there, Grubhub or grocery delivery services. Number two, I want you to seriously consider the secondary and tertiary impacts of any decision you make. You look at the increase in suicide and alcoholism and drug use and overall depression. It goes back to the wellness of point one. The Anchorage Daily News had an article today that talked about 3,000 job loss in the oil industry related to the pandemic and impact of it. Three, key point, all businesses are essential. That's not your decision to make what businesses are essential. Open the schools back up. Four, I think pretty clear that the effectiveness of mass is certainly in question. I did over 30 years in the Army, a lot of nuclear, biological, and chemical training. If you'd ever given me one of these and said this is going to help you in a biological environment, I would not have believed you. Five, make sure that the cure isn't worse than the disease. Consider the cost. Consider the cost. I agree with everybody, the virus is real, the virus is here. I've had family members who have gotten the virus and gotten sick. They've recovered. Most people will. Well, it's time to get back to normal. Anchorage is a tough city. Alaskans are tough. We can do this together. Thank you.
Thank you for your testimony.
Any questions?
Nope, I don't see any. I'm going to take a short break.
I thought you were talking to me. Well, it's kind of impossible to do that. It's like trying to drink a soda pop with a mask.
Yeah. Well, so I'll just ask if you can please put it on, keep it on.
What is this section for again?
Yeah, I explained it earlier, just so
I
people
know you
can
did,
take off.
I'm an old guy, so I don't remember a lot.
Sure, just so people can take off their mask when they're at the podium.
So they can take their mask off?
When they're at the podium, yeah. But otherwise, no. Unless you're like drinking water. But anyway, I think you know the rules, I think, sir. So I'm just going to ask you to put it on. I just wanted to do this one-on-one.
Thank you. Thanks for being so cordial. And you know what? Interestingly enough, I'm not a young Democrat. So. Sorry. I knew he was.
For folks on the phone, we are about to be done with our break, so we will get started here in a second. All right, we'll go ahead and get started again. Welcome.
For the record, my name is Donna Celia, I'm short. Is that okay? So I came here because I am outraged that you skipped our right under the charter to elect our own mayor, and now today you want to give that illegal imposter access to all of the emergency powers that she could possibly grab at this very moment without our consent, we the governed. So I'd like to start by saying that you are unconstitutionally denying us the right to elect our own leadership. You are happy to destroy businesses and make thousands of people unemployed and poor. And we the people look and see what you are up to. Your fanaticism is out there in the open, and untold thousands of us who are suffering at most of your hands know what you are up to. The game is up. Eventually, we will have the opportunity to vote against you. We may even have that opportunity sooner than you think. Because when you violate the Constitution and the law that you swore to uphold when you took your seats on this assembly, then you invalidate your right to sit here at all. I'm not wearing a mask today, mostly because it's been in the bottom of my purse for the last 4 months, and it's filthy. I'm going to breathe the fresh, clean air that God gave me in this beautiful city. Thank God that still hasn't been soiled by you. And I'm going to do so with the fresh, clean lungs and clean nose and clean nose hairs that I will retain for myself and my family every day, despite whatever it is you have to say. And eventually, very shortly perhaps, I will have brought a victory to this city by removing all of you from your seats, because you definitely violated the charter and you definitely overstepped the boundaries of your authority. It's over now.
Thank you for your testimony. For folks on the phone, I'm hearing a little bit of background noise, so please make sure that you are muted. Thank you. Welcome. All right, that's Exhibit A of the background noise that I'm hearing. So if you could please, if you're on the phone, please make sure that you are muted. Thank you. Welcome.
Hi, my name is Jessica Reed. I am a mother of 6 between the ages of 1 and 14. My paycheck is the same whether you close businesses or not. I am here to speak to you on behalf of the children and all the moms and parents at home who are probably
Could you move your mic just a little up, please?
Working.
Thanks.
Who are probably working or putting their kids to bed or eating dinner with their kids or picking them up from gymnastics and can't be here. So when you hear the points that I'm going to present to you, I hope that you magnify them by 100 or by 1,000 for my friends and family who can't actually be here. I am here because I'm against Resolution AR 2020-398, and there's several reasons why. As I'm reading this, I keep on getting stuck on the fact that this is the 6th extension of an emergency order. What did you do during 1 and 2 and 3 and 4 and 5? An emergency is something that comes up and you need to handle right away. An emergency doesn't happen 9 months later when you have a plan. I'm not here to debate about masks. I'm not here to debate about who is susceptible. I am here to ask that my children have the opportunity to take gymnastics classes, that I can go out on a date with my husband and sit in a restaurant, and that I can make that choice for myself. I support my friends and family who feel like they are not healthy enough or that they have risks to where they want to stay home. I'm not going to barge down their door and bring in my germs, but please, don't tell me that I can't go into businesses, that you are going to make
Apologies.
them shut down.
I'm going to pause your timer. I just want to make sure. I think as we were messing with things, the folks on the phone can't hear. Okay. So folks on the phone, can you hear now?
Yes.
We're back.
Okay, great. Go ahead.
I just want to have a choice. By shutting things down and giving the mayor this emergency power, you are telling your people You are telling us that you don't trust us. You don't think we're going to make the right decision, and somehow we are going to kill everybody. So you can call that fear. Maybe you're making decisions based on fear. Just for background, my degree is in biology and physiology. I understand the science. I don't know everything about the virus, but guess what? Neither do the experts on the virus because it's new. Let us live a full, happy life. Let us go out and have the opportunity to shop, to work. Don't add more stress. Right now, I'm not just a mom. I'm having to educate my children in my home, and you're taking away more of my support system. 100% of the people who've died from COVID are going to die anyways. I can skew those statistics too.
Thank you for your testimony. Welcome.
My name is McKinley Reed, and I'm representing every child in Alaska and every child who shouldn't have to not be able to go to school because of decisions made by adults that we just don't have the chance to, I think we should be able to have the chance and the choice to be able to grow up in a place where I can go and to school, where I don't have to have my education based upon how good my internet is, or if I can get that education that I need. Like, how are people going to be able to learn math when their Zoom meetings are unfunctional because we're not able to do things that we need to do to be able to learn these things. And if you shut these down, it's not going to make anything easier. You're kicking yourself in the foot. You're not making the emergency, you're making it worse. And in school, we learn about how America is a free country and all the great things like the Declaration of Independence. And if you are as the government are making decisions that aren't just and that aren't lawful, you shouldn't be able to make those decisions. And I think it's your responsibility to make the decisions that are the best for posterity's sake, and for people who will grow up and to be able to and to have these decisions that I'll be able to vote next presidential election, or I'll be able to vote for my state's government in just a couple of years, and I want to be able to have that confident thing that I know that the government that I elect will be able to make good decisions and not make decisions that make it so people can't work, that people lose their jobs, and they're doing that on purpose just because they are fueled by fear. Thank you.
Thank you. I actually have a question for you from Ms. Allard.
Thank you. You said your name is Ms. Reed. What high school do you go to?
I'm actually a middle schooler.
Oh, wow.
Yeah, and I was going to Golden View, but my mom was just the one who talked, and she's homeschooling me, so. Yeah.
Well, your mom's doing a great job. You're very well spoken. So I want to encourage you. How do you feel? How's your mental state? How are your friends feeling?
Well, I can tell you every single time you say that we're going to be able to, the school board says that we're going to be able to go to school, and then that we're not able to, they're like, we're not going to be able to learn. Or how many times my friends tell me we got a week to learn 4 weeks of math, and it's not working.
It's not working, so the school system's failing you? Do you feel like the school system's failing you?
I feel like the government is failing me.
You feel like the government is failing you? So I want to encourage you to keep fighting Freedom isn't free. It's one of my favorite sayings. I want you to go study that. Find out all that that means, and you keep up the good fight, you hear? Thank you.
I shouldn't have to fight
Thank
for
you.
the freedom that was given to me.
That's right.
Thank you for your testimony. Welcome.
My name is Erin Ursland. I had no intention of talking tonight, but this is just crazy that you guys are planning on shutting us down again. I don't know who so rudely asked this gentleman back here what his credentials were, being that he is in the medical field, but what are your credentials to tell us what we should be doing in a medical situation? I'm guessing none. That's my guess. And another thing is, who's going to pay my bills when I don't have a job, when I can't work, when I can't pay my mortgage, when I can't put food on the table? Not just me, but everyone in this town. I mean, what's the plan here? What is the plan? When you shut things down, jobs go away, they don't come back. So what's the plan there? Are you willing to give up your salaries? Are you going to give those to me? What happened to the CARES Act? I haven't seen any of that. So what are you doing for the people that want to work? All we want to do is provide for our families. That's all we want to do. Let us make an informed decision on our own. We are adults, okay? If I want to take on the risk to go out, let me take on that risk. That is my risk. That is my right. These are my liberties. I don't want to listen to what you have to say to tell me if I can go out or not, okay? That's all I have.
Thank you for your testimony. Welcome.
Thank you, Felix. My name is Christine Hill, and you've heard some outstanding testimony this evening, outstanding testimony from these people that are here tonight, that have spent and waited their time. Bernadette Wilson actually had an extremely good point. Put yourself on the line. This is, give up all your salaries, and I know some of you don't have full-time jobs during the day. Give up your salaries. Put yourself on the line with these decisions that you're making. You are oppressing Anchorage. You are hurting Anchorage. I can't believe that we can't clap. I'm almost losing my rings by going like this. And that's what I have been doing. I haven't been clapping. But to be pointed out, I'm willing to be escorted out if that's what you'd like. Hopefully they have fur handcuffs. But I believe in Anchorage. I believe in Alaska. I believe that people should be able to make their own decisions and choices, understanding the risks that they may take. I would hope that you would actually support and believe in Anchorage like I do. Let people make their own decisions for themselves and their lives. Don't control us. I don't want to be controlled. And I have many friends and acquaintances that have gotten COVID and have survived. I don't know anyone who has perished because of having COVID, except for possibly my brother might. He lives in California and he can't get the cancer operation that he needs because the hospitals are empty, but they won't allow him in for his cancer treatment that he needs. So I would hope that you really think on this. I don't know how much you actually listen, and I thought it was actually very interesting that someone who testified tonight actually turned around and spoke to the audience. But please quit oppressing us. You are hurting us. You are harming the children. There have been suicides. There have been real deaths in connection with COVID, but it's not because they've caught actually the virus, but rather the effects of what you're doing. We also, I do know that there are emergency measures in place that if the hospitals do get full, there are other places. And we are Alaskans, and there are going to be people that will come out and work 24 hours to be able to help other individuals get through this. And I have to say also, it's thanks to our President Trump that has actually gotten us to the point where we are going to be having vaccines very close. And it's because of our president and good government and good governing that have gotten us that. Thank you very much.
Thank you for your testimony. Welcome.
Can you hear me okay? My name is Eugene Carl Haberman. 43 years Alaskan resident, 20 of those years an Anchorage resident, and currently a Valley resident, Matsu Valley. To follow the public process, when the public process is done appropriately, the decision made by the governing body is more likely to public interest. I'm sorry the chair walked away from my comments. It would be nice that you could hear it. This is about the sixth extension of the Declaration of Civil Emergency. That's what this is about. Prior to this, where was the public hearings? You put it on the consent agenda, and you allowed a situation where the public had little input to whether or not you should extend the emergency. But there was a commitment prior to the last extension. The Assembly would have a public hearing a few weeks before the decide on whether to extend the emergency. But what do you have here is a resolution, not an ordinance. And as was said earlier in the meeting, Member Wellington said that we're working on it a month or so later, we'll have other papers and so forth before the public. But the public is blind to what is the history of what you've done in Anchorage. The legislation, whatever has been here. What you have here is an administration who's not present here. Unfortunately, not one member is present, but remotely. But there's for reading for tonight, reference to this is asking you to decide on what they think. Now, this is what I have to say. That the COVID is a serious issue. There's no question. It's a worldwide issue. But it's important in COVID that you have more of a conversation with people, not less. You've shown a history of contempt, providing that episode situation as far as providing a conversation. But tonight, most of these people here, we're not talking about this, but we're taking another angle, but not going and addressing it. Do you want to extend an emergency situation? But I remind you also of the pattern that's happened before the current mayor and the past mayor. A situation where the Assembly led it up to the administration, very little information coming from the administration, and you just signed off on it. And where was that conversation with the people? That conversation with the people was not there in the consent agenda because the public couldn't speak. You decided the consent agenda, item after item that referenced COVID. Money and so forth, that's what you've done. Now, I'd like to close with this thing because it concerns me and remind you those here in the public that would disagree with me. But those who are questioning the responsibility of wearing masks and they're fighting it, they're confusing freedom with responsibility. And that's what it's about right now with those masks. It's a responsibility for all of us to take part and be responsible to deal with this issue and not protest the right to wear masks.
Thank you for your testimony. With that, we're going to take a short break. Welcome.
Hi. Can you make sure everybody on the phone can hear before?
Sure, yeah, just want to confirm folks on the phone, are you back with us?
Yep, I can hear. Thank you.
Great, thank you.
My name is Marie Caswell, for the record. I would first off like to say thank you to everybody who came and testified this evening. I echo much of what was said here. Just in case it isn't obvious to the Assembly, I would like to point out that most of the constituents that testified tonight are against the extension of the emergency order. I am as well against the extension of the emergency power orders, whatever. And I just want to say that there are a few members of our community that have been instrumental in this awakening that you have been able to witness. They're not feeling too well tonight, so out of an abundance of caution, they made a responsible decision to stay home.
They exercise their own judgment with care and consideration for their community as a whole. We are asking you to do the same. Have faith in the people you are supposed to serve. Have faith that we, the people, are capable of caring for our community without your oppression on our personal lives and freedoms. We do not need mandates to be responsible in caring. I can guarantee that if you step back, each of us will make the right choices to protect ourselves and our community. I believe that hand washing works. I believe social distancing can be helpful for the vulnerable population. I believe bolstering our immune system is instrumental in fighting any virus, including COVID-19. Masks, however, have been proven over and over to not only not work, but actually contribute greatly to the spread of the virus. The data is out there. I suggest you go find it. I would also like to say that I do not think a vote should happen tonight, especially seeing as a majority of the people that are supposed to be voting aren't even here. They're on the phone. Like, who knows what's going on wherever they're at? What if they're being pressured to vote a certain way and we can't see that? I don't think it's appropriate. Last but not least, you have a choice here. Give us our lives back or prepare yourselves for a revolution on which you will be on the wrong side.
Thank you for your testimony. Would anyone else like to testify on this item? Anyone at all? Seeing and hearing no one, public testimony is closed. What is the will of the body?
Move to approve, Zalatel.
The S version, Ms. Alatel?
Yes, thank you, Mr. Chair.
Thank you. Is there a second?
Second, Dunbar.
Seconded by Mr. Dunbar. Thank you. All right, so we have one amendment, and then I'll call to see if there are other amendments, and then we will have general discussion. So we're going to start with proposed amendment number 1 by Assembly Members Zalatel, Rivera, and Dunbar. Is there a motion?
I move Zalatel Amendment number 1.
Is there a second? Seconded by Mr. Dunbar. Ms. Zalatel, do you want to speak to it?
Sure. Thank you, Mr. Chair. I think the amendment pretty much speaks for itself, but it's really to have the administration provide us a clear set of metrics that reflect key indicators for when the municipality may make a decision to tighten or loosen restrictions, which could result in revised or new emergency orders. I believe there are a lot of metrics already used within the municipality. This just puts a clear public face on them so that not only is the assembly more informed, but the public as well. And particularly, it can be a tool where we can see how the community behavior is affecting the metrics that really drive the decisions made by the administration. I know this can't happen overnight, but as soon as it's ready, the municipality, so the administration and the assembly together should do a public education campaign about the metrics. But in the meantime, we do get our weekly updates during the course of the when an emergency declaration is in place, and we would request that those updates on the metrics and the dashboard be included in the updates. Thanks.
Thank you. Mr. Whittleton on the amendment.
Thanks, and to, I guess, any of the sponsors, I mean, this looks fine, but it seems to me that this is already happening. If you go to the website and hit that big COVID button, you get to the various things, where we get the, green, yellow, and red circles for various parameters. I mean, your intent must be to enhance that in some way. Can you clarify that a bit?
Ms. Zalatel?
Yeah, there's been a little bit of noise on the line. So if I heard correctly, that there are already quite a few metrics on the website. And yes, it is to tie the metrics more closely to those things that drive decisions. I think there's a lot of information on the dashboard, and we get a lot of questions as members, I know I do, about which metric is responsible or which thing is responsible for a particular, new emergency order or a revision to an emergency order. And it's really hard to point to that one thing, or there is sometimes particular weight given to one metric, whether that's ICU bed capacity. And I think we all know it's more complex than that. So I think we could just work together with the administration to do some refinement based on what we've learned, and so that we can be as transparent as possible about not only when the decision is being made, but what's leading up to the decision point.
Anything else, Mr. Weddleton?
Not right now, thank you.
Thank you. Ms. Allard on the amendment?
Thank you. This question would go to any of the sponsors, but you say in section 3, UAA and other partners, obviously this is going to pass tonight, so I'm going to try to soften the blow. So Department of Health and Social Services, is there a reason we don't spell that out and put that in there for the state of Alaska and Center for Disease and Control Prevention? And is there going to be a cost to this new education?
Would someone from the administration like to respond to that?
This is Austin Quinn Davidson. So you're asking about the language for the amendment, correct, and why DHHS wasn't included? I think I would ask the sponsors, but it would be fine with us if they were.
Yeah, apologies. I think this was in two parts. It was, you're correct, Madam Mayor, the first part, and then the second part was estimated costs for implementing the amendment. So if you could, if there are any ideas on that second part, then I will go to the sponsors.
I think it depends on what a public education campaign looks like. I mean, we're already working on telling the story with our community partners around COVID and what's happening in the community, but I think there's an opportunity to do more of that. I guess I can't speak to the exact amount since I don't know exactly how we'd be telling that story, but I think that the administration's interested in doing more to the extent we can.
Thank you. Ms. Zolotel, did you also want to respond?
Sure. Thank you, Mr. Chair. I appreciate pointing out the state and the Centers for Disease Control, I believe, was the other one. I have no problems. Those are all intended to be included. They may not be spelled out, partly just for brevity's sake, but I believe that they are already resources being leveraged and information being utilized by the municipality. So I'm not asking for any exclusion of information. I just simply wanted to illustrate that we should be utilizing all the various forms of information available.
And I guess just a quick response from me before I go back to you, Ms. Allard. So there's also, I think, 3 keywords in here that add the flexibility to reach out to other partners, which is exactly what I just said, and other partners after Anchorage Health Department, comma, UAA, comma, and other partners. So I would suspect that CDC, the state, and any other partners would be included in that catchphrase. Anything else, Ms. Allard?
Yeah, Chair, I would just kindly disagree with you because we've seen what happened with the charter when things aren't spelled out properly. So I would like to amend the amendment and add Department of Health and Alaska Department of Health and Social Services along with the Center for Disease Control and Prevention, please.
Is there a second?
Second.
Seconded by Ms. Kennedy. Did you want to speak any further to that amendment to the amendment?
No, I think it's pretty clear. Thank you.
Thank you. All right, so I'll go ahead and go through the queue on the amendment to the amendment. Ms. Kennedy, did you want to speak to that?
Well, just briefly, thank you, Mr. Chair. I mean, I think it is important that we recognize that there is an awful lot of information out there, and the more we have, probably the better. I hope that's what that means.
Obviously, there's a lot of interpretation that goes with any of the data that's out there, and so to have enough of the experts, I suspect, to actually not only look at data, but interpret what it really means in terms for our particular situation would be helpful. So I think it's a good idea to add specifically those other named departments and entities. Thank you.
Thank you. And just to clarify, you want me to keep you in the queue, Ms. Kennedy?
Yes, I do, please.
Okay, thank you. Mr. Perez-Verdia, did you want to speak on the amendment to the amendment?
No, thank you, Mr. Chair. Just the amendment.
Okay. Seeing no further discussion. For the record, the clerk was just asking me to clarify where this amendment was in the amendment itself. Okay, so seeing no further discussion, members may proceed to vote on the amendment to the amendment.
Mr. Peterson?
No.
Mr. Dunbar?
Yes.
Mr. Constant?
If you said Mr. Constant with a little muffled, that's a yes.
Thank you, Mr. Constant. Ms. Kennedy?
Yes.
Mr. Perez-Verdia?
Yes.
Ms. Solotel?
Yes.
That amendment to the amendment is approved 9-1. We're now back on the amendment. Ms. Kennedy.
Thank you, Mr. Chair. My question might be for the maker of this motion, and I was just curious as to the interpretation of the term current information. One of the things that I think has been lacking in some of the data that we get has been things like those people who maybe are testing positive yet are showing no symptoms, that we seem to be holding at about that 40% threshold on that number. I know I have a friend who tested positive but had no symptoms and was told that after 14 days he can't test again. You're not, I guess once you test positive you can't retest for 60 days. But anyway, was basically told that after 14 days of quarantining, if he still had no symptoms, he was, free to go about normal practices with the normal precautions that we're all told to be taking at this time. So again, I think we ought to have a decent amount of information given to us about the number of people that are testing but are asymptomatic, and then I also think we should be using the number of people that have recovered, the ones that we believe now are immune and do not pose the same kind of threat to the community that they might have when they were first tested and might have been infectious. So I think it's a good number also to have. So I just wondered if that kind of information was the current information that might be being referred to in this amendment. Thank you.
Thank you. I'll go to Mrs. Zolatil. Do you want to respond to that?
Sure. So the current information would be the information being relied upon. I mean, we need to read the whole thing together, and so it really needs to be all of the things indicated in current information that reflects the key indicators and thresholds for risk the municipality relies on in deciding and making decisions. And I think that that's the key point there. So my guess, and if someone from the administration wanted to talk more to it, it includes things like recovered individuals, because that's information the state is providing. It's information on our dashboard. This is really intended to take that information and all of those things being considered and put it in a little bit more of a usable format as it relates to predicting decision points or being predictive of decision points or where we're coming to a point in a decision.
Great, I appreciate that. Thank you, Ms. Zolotel. Thank you, Mr. Chair.
Thank you. Mr. Perez-Verdia on the amendment.
Thank you. My question actually goes to the administration. Just want to get a sense from them on their role in this amendment. Are they aware of it, and do they support it? I share Mr. Weddleton's question about. I feel like we have most of this information, so this feels like an enhancement. And I just want to get a sense from the administration in terms of actively working on this. Is this something that they feel like would be beneficial and doable?
Who from the administration would like to speak on this?
Jason, would you like to take that one, or go ahead?
Yeah, hi, Mr. Chair, this is Jason Bockenstead.
Mr. Bockenstead, you're really soft on our end. Could you speak closer to the mic, please?
Sure, is that better?
No. Are you on speakerphone?
I was. Is that better?
There we go. That's much better. Yes.
Okay. Yes, through the chair, Assemblymember Perez-Verdia, we were alerted to the amendment. It was shared with us, and we are certainly supportive of it. We are constantly looking for ways to improve how we communicate all of this information to the public. Certainly, we will reach out to Assembly members and continue to figure out how we can do that in a better way. I think even as the sponsor has noted, a lot of this information is available either on our COVID-19 website at muni.org or in the Assembly report that we provide to the Assembly every single week, and is ultimately also introduced as a public item or information memorandum on the Assembly normal Assembly meetings. So we will continue to try to improve how we communicate that information, and if there are ways that we can get that from the Assembly, we're always open to hearing how we can communicate it better.
Thank you, Mr. Chair. That was great.
Thank you. Seeing no further discussion on the amendment, members may proceed to vote on the amendment.
Mr. Peterson?
Yes.
Mr. Constant?
Yes.
Ms. Kennedy?
Yes.
Mr. Perez-Verdia?
Yes.
Ms. Zolotel?
Yes.
Then,
Did you call me?
Nope, I missed it. I am sorry, Mr. Dunbar. Let me do that again. Mr. Dunbar?
Yes.
that amendment is approved 10-0. All right, that was our only prepared amendment, so I'm going to go down the queue that I see. Ms. Kennedy?
Thank you, Mr. Chair. Excuse me. My comment or question is in regard to process. And so now that we have this new process of needing to have a testimony period for public testimony 2 weeks before the end of a declaration deadline, and I'm assuming before we do any kind of extension that means we will be voting on this in 2 weeks. Is that correct? Or a final vote for however it is amended? Thank you.
Thanks. I'm happy to respond to that. So the move to approve and the second, the main motion we have on the floor is for the S version, Ms. Kennedy. And the S version extends the emergency declaration through January 15th, 2021. I'm just trying to figure out. And then section 4 addresses the public hearing, which I will just state it in here. Any further extension of the emergency order shall be subject to a public hearing to occur at least 3 days before the expiration of the declaration of emergency. So it could be 3 days, could be 2 weeks.
Okay, can I just clarify that then?
Go ahead.
Thank you. So in other words, we are changing the previous resolution that established the 2-week period for public testimony before the deadline in this new ordinance, or in this S version?
Let me just double check one.
So in other words, we are...
In the original, Ms. Kennedy, Section 4 also has that same language. And I can ask Mr. Gates to address this because Mr. Gates had some difficulty with the previous language that was added to the floor. And as you may remember, a lot of us had some difficulty on that amendment on the 2 weeks. So this was something that Mr. Gates crafted, which he thought would be much better manageable for us. So I'm going to go ahead and turn to Mr. Gates. Mr. Gates? All right, I will go ahead and see if we can get Mr. Gates back. I'm not sure what happened. But Ms. Kennedy, I'll go ahead and, did you have any other points that you wanted to raise, Ms. Kennedy?
Well, no, I think that's the big one, knowing whether or not we're actually following the process that we approved weeks ago. Thank you.
Thank you. All right, Mr. Gates, just let me know when you're back and we will come back to you so you can respond to Ms. Kennedy's question. I'm going to keep going in the queue.
Hello, can you hear me now?
There we go. We can hear you now, yes.
Oh, sorry. Yeah, I'm not used to calling on phone. So, Mr. Chair, I was actually typing a little advice to you when the question was asked, and you wanted me to explain about the 2 weeks language, right?
Mr. Gates, I think we might have lost you. Did you put yourself on mute? There we go.
I'm sorry, could you repeat the question for me? I was typing something while it was brought up.
Sure. Ms. Kennedy, could you repeat the question, and then we'll go to Mr. Gates to respond.
Thank you, Mr. Chair. Mr. Gates, we had a resolution or an amendment to the last extension of the declaration that said that we would have a testimony period for public testimony 2 weeks in advance of doing any other extension of a declaration. Is this new S version basically overturning that particular amendment to the previous extension, or is that 2-week requirement still in play? So that's the process question about how we're doing this tonight and voting on an extension tonight when we just had the public testimony. Thank you.
Okay. Thank you, Mrs. Kennedy. So that 2 weeks requirement was in Section 4 of AR 2020-279 as amended, and so that 2-week requirement is going to stay in place until it's changed by subsequent action of the Assembly. And so tonight we have AR 2020-398 before us, and this is the subsequent action of the Assembly. So if that changes what was done or what was required by the previous resolution, then it will change. So Section 4 of the AR we're looking at right now 2020-398S, it does make a change. It actually is the same language as AR 2020-379, but it just says 3 days before. And so if we pass this with that language in Section 4 in this S version, without amending it now, then going forward it would be the new requirement. Instead of 2 weeks, it would be 3 days. So it's just what's the most recent assembly action and that it resolved would be required. And that's what we're doing tonight if you pass this language for 3 days. And as the chair explained, I had suggested that because it would be more manageable. And I think that it accommodates having, for example, a declaration expires Friday, which I guess the administration has tended to offer expiring Friday at midnight. We could have a public hearing on Tuesday meeting. Or if it expires on Monday, we could have the public hearing on Friday. So that is sort of the thinking now. I hope this helps.
Mr. Chair, can I get further clarification then?
Sure, go ahead.
Okay, if we pass this S version tonight, it says that any further extension after this one, after 398S, there will be a 3-day period. But we are still operating under the old extension, which says there will be a 2-week period. So 2 weeks prior to the actual deadline. So we're still working on the deadline of November 30th. And after this passes, if this passes, then there will be a 3-day a requirement for a public hearing 3 days prior to a declaration. So in other words, my question then, I guess, still stands as to whether or not we can actually approve this tonight, that we can vote on it, because we have not fulfilled the requirements of the last declaration that says we have to do it 2 weeks before the deadline. So we can't vote on anything until that deadline. We're only working at making sure that we have the public testimony, but the deadline that we're actually still working on is November 30th. So I guess that's my real question, is whether or not we can actually even vote on this tonight, or because we have just now fulfilled the public hearing part of it, then now we have to wait the 2 weeks before we can actually vote on this.
Mr. Gates?
Thank you, Mrs. Kennedy. I read the language as being very specific and as it addressing a very discrete action. So the language of the AR, previous one, 279, as amended, was that the public hearing is to occur 2 weeks before the expiration of the declaration of emergency period. It doesn't refer to when the assembly action should take place. And that's what we're doing now, is assembly action. So we held the public hearing, it's now closed, and it's 2 weeks before the expiration, November 30th. But assembly action, it has to follow the public hearing. But that statement doesn't say when. So the assembly action, whether or not to extend beyond November 30th is the assembly action, with this resolution for you. That assembly action can take place any time between now and, I guess, November 30th, if you wanted to do it at a future meeting. So I don't read the language as making any specific reference to the assembly action, a discrete action, separate from a public hearing. We often have a public hearing and have assembly action later. Sometimes it's right after. So I see this as being the assembly's prerogative, whether you want to take action tonight or postpone to a later date. And then I guess think I would mention that the action tonight is to extend to January 15th. And so in the current resolution before you, when it says any further extension, if you take action tonight, it's now good until January 15th. further extension would be beyond January 15th, so you have 3 days before January 15th to have a public hearing and take assembly action.
Thank you, Mr. Gates. And Mr. Chair, I guess I will just comment that I think it's rather disingenuous that we went to the extent to try to give a 2-week notice in regard to when we would have any kind of public conversation about the potential for the extension of a declaration. So I will not be supporting this. Thank you, Mr. Chair.
Thank you. Mr. Constant, so what I'm going to do is I'm going to go to the next 2 folks in the queue simply to address this issue, and then I will go back to you, Mr. Constant, to address any other issues that you would like. So, Mr. Constant, on this specific issue?
Yeah, on this specific issue, I believe it's pretty darn disingenuous to claim that we stated there would be a 2-week delay after public hearing before we voted. That wasn't at all in contemplation of what we addressed when we passed that resolution. What we said is we will have a public hearing. And the reason we said it 2 weeks in advance was because we wanted to make sure we had enough time before the public hearing in case waves of the public came out to testify, which a small wave did. And so I believe we are acting in strict compliance with the text of the resolution that was drafted and passed by the body. I certainly would have never voted yes on a resolution that said we will have a public hearing and then wait 2 weeks to vote. That's not how we conduct our business. Now, I have a matter that's separate from this that I would like to bring up, but I think I'll wait until you move to the queue, people who want to address this topic.
Thank you. Yes, I'll keep you in the queue. Mr. Weddleton, specifically on this point, and then I'll keep you in the queue.
All right. Thank you. So I think listening to Ms. Kennedy's point is if it sounds like with this resolution becoming effective immediately, it kind of overlaps the other resolution. And I think maybe Dean said that's not quite right, but I wonder if we could make it more clear by amending Section 3 to replace the word passage. So this would read, the resolution shall be effective immediately upon expiration of the 5th extension. So we delete passage. Does that help, Ms. Kennedy?
Thank you, Mr. Weddleton. And through the chair, I think I don't know that it's it doesn't really resolve anything. I think it is that time period that I know when I saw the original resolution, I thought that's a good idea to have the public testimony and provide some buffer between the public testimony and the time when a declaration would have to be extended if we were to decide to extend it. So from my perspective and how I interpreted all of that, and I can appreciate Mr. Constant's comments on that, but I think, like I said, in terms of what it was telling me when we voted on this, it made me believe that there was going to be a little bit of, a 2-week period there, particularly by which potential amendments could have been made. I know I have 2 amendments that I have asked for and will not have tonight. So essentially, Mr. Weddleton, no, it doesn't quite get to the root of the matter, but I appreciate the thought. Thank you. Thank you, Mr. Chair.
Thank you. All right, so with that, I'm going to go back in the queue. Mr. Constant?
Thank you. Mr. Chair, I would like to call Dr. Andrea Caballero, epidemiologist in Anchorage. Did that come through?
Yes, we are calling the doctor right now.
This is Dr. Caballero.
Hi, Dr. Caballero. This is Felix Rivera. You're here with the Anchorage Assembly. We are currently in deliberation, and Mr. Constant wanted us to give you a call. Mr. Constant?
Thank you. Dr. Caballero, I'm grateful for your willingness to speak before us tonight. It was a little quiet when you spoke, so please do speak up if you can. I have just a handful of questions I'm going to pose and like you answer. First, can you briefly describe to us your credentials and your position in the community? Second, would you describe, could you describe the current trajectory of the pandemic and the medical resources we have available in the community? Would you also provide a recommendation on passage of extension of the emergency or not? And finally, can you give us a little bit of a philosophical look at what does the end of this pandemic look like for us?
Absolutely. Can everybody hear me?
Yes, and actually before you go, so I'm hearing some chatter in the back and some retorts. I'm going to ask that folks please leave that to yourself, please. Go ahead, ma'am.
Yeah, I'm Dr. Andrea Caballero. I'm a board-certified physician in infectious diseases as well as adult internal medicine. I work at Providence, Alaska Medical Center, at Alaska Regional Hospital, and St. Elias Specialty Hospital. I do inpatient care, so care of patients in the hospital, as well as clinic patient care. I work in infection prevention, which means how do we isolate patients and keep both our patients and our staff safe in the hospital, and antibiotic stewardship, or antimicrobial stewardship, I should say, which has to do with implementation of treatments in the hospital. I also consulted as infection prevention for the Alaska Airlines Center when that was put together. I have seen over 100 COVID patients in the hospital setting. To put it into context, there's been a total of 560 in the state to date. I have worked on multiple investigational treatments for COVID, protocols and how to implement them at the different hospitals, and also have worked with the state on how to distribute certain allocations that we have gotten at a statewide level. I'll start by answering your following questions, Mr. Constant. The current trajectory, this keeps growing. I don't think that that is any surprise to anyone. Anybody who has seen any of the projections see that they're going up. I think one of the things that gets missed in a lot of these projections is the lack of staff that we have. We do not lack so much physical space as we lack the staff to run the physical space. The reason that the Alaska Airlines Center cannot be opened overnight is because we do not have the staff. There is no unlimited medical staff in the state that we can tap into. There could be a more national response, but waiting for us to reach emergency levels where we are requiring a national response would be irresponsible and dangerous and would cost us lives. When it comes to medical resources, we are always competing with a national pool. At this point, we still keep close tabs of what PPE or personal protective equipment each hospital has every single week, and sometimes more frequent depending on how our supplies are looking. We do the same thing with treatments. We have had to come up with protocols of how to reuse PPE in the hospital, and there have been points where we have had to reuse masks. Same thing with treatments. We have created protocols trying to keep our biases and getting the ethics department involved to decide who would get what treatment in the case that there's scarcity. Your second question, absolutely, I think that the passage of extension is necessary. If we are seeing the numbers that we are seeing under the current guidelines, being more lax would only mean more community transmission. And I think this idea of herd immunity is a false sense of security that a lot of people have. We do not know how long immunity lasts, but we do know that we have seen people with recurrent cases of COVID, including here in Alaska. We think that the protection window might be about 3 months, but we don't know really how long it is. So yes, I recommend it, and the proposed date of January 15th, I don't think is going to be enough time. I think you will have another one of these meetings before that day approaches around the new year. Your third question, Mr. Constant, things that you might be missing, is that correct?
Yes, things that we should be aware of that we might not be thinking about. You know, your summary, where should we be looking? And what's the trajectory? When do we see our way through this?
Yeah. So I think that, you know, I heard parts of the statements tonight by the public. I think that we need to understand that statistics are statistics. I like to think of a phrase from Brené Brown that says it's hard to hate people up close. It's also hard to appreciate a pandemic when you're not having patients die in front of you every single day, which is what many of us are seeing. Not every single elderly patient is going to die from this, thankfully, but also not every single kid is protected from this. We have started seeing cases of what is called MISC, which is a post-COVID inflammatory syndrome in children that can have pretty dire consequences. I cannot speak more about that because I do not see pediatrics, but I know some of my partners that are seeing those cases. Resources take time to get here. We expect to have a vaccine available by the end of the year, perhaps at the end of December, perhaps at the beginning of January. We do not know how many doses will be available, how many will be distributed to Alaska, and how the vaccines would be distributed at that time. Right, that is an algorithm that we still don't have in place, but the reality is that we're not going to have enough doses for everybody to get vaccinated, so there will be a stratification that sort of picks and chooses who gets it first. How does this end? This ends with massive vaccination, and that won't happen for a couple of months. I have personally set my goal of 2022 as the time where I will be able to freely, safely, for my patients and for my colleagues and for myself, able to travel out of the country to see my family. I think that by next summer, things are going to be better because we probably will have a lot more vaccines. A couple of things to keep in mind about the vaccine. One, it will, like most vaccines, take a couple of weeks for you to become immune. So it's not like you get the shot and you're free to go. It'll probably be at least a 2-week window or so. We don't know how long immunity will last. We know that right now, at least the preliminary vaccines will need a booster shot a couple of weeks after the first one. So it means that you probably won't be fully immunized for a couple of weeks, month and a half or so. So next summer, if we're lucky and we get a lot of vaccines, I think life could get seemingly normal. It remains to be seen what happens once we get into fall and we have a concurrence with the influenza season. That's all I have.
Thank you very much.
Thank you. All right, so I'm going to go and see if folks have any questions for the doctor while we have her on the line. Mr. Weddleton, did you have anything? Go ahead.
Yes, I do. I have 3, and you can cut me off if need be. So I'm really happy you're here. Thanks to you and Mr. Constant. So we had a couple comments today, and one was, why don't we just go get foreign doctors to the staff? Can we do that?
So, no. Right, we have certain standards of medicine in this country. There have been certain measures that have been passed to expedite licensing at different facilities so that we can get, nurses and respiratory therapies and, other physicians approved. But there has not been any chatter about us allowing, foreign medical licenses to come practice in this country, and this would have to come up with much higher powers than any of us.
Okay, thanks. And then another one, I think in the world of motorcycle helmet battles, the rally thing is educate, educate, don't legislate. And that's kind of what we're hearing from a lot of people here. It's just, look, you told us what to do, and we'll do it. And so as an epidemiologist, I mean, why won't that work? Or will it? Why can't we do that?
Education takes time, right? And if we are seeing that people are having issues, right? If people were educated, they wouldn't have an issue with social distancing and masking, right? The same thing that it took years to convince people to wear helmets and to wear seatbelts, and it took years and years and years and decades and decades and decades to convince people that tobacco caused lung cancer. We're not going to educate people in 6 months, right? And I will tell you that I observed very closely, and the way people wear masks is often not appropriate. So sure, let's keep educating, but until that education sinks in, we need to give more guidance.
Okay, thank you. And then one last one. So we have had 8 months to try different things, and we had the hunker down, and then we loosened back up, and then some cases started rising, and then we had a mask mandate kicked in. Then we closed the bars and restaurants, I think maybe gyms, but bars and restaurants for a month, and then opened them up. Now we've tightened up the mask mandate. So we've done a variety of things. I mean, is there a way to look at each of those things and see how it worked? Or are we just going on faith?
No, we have data. The thing to keep in mind, too, is that our resources for testing in particularly have changed dramatically, right? When we had the hunker down in March, Alaska was in a very tough situation, because I will tell you that every single time we had a patient that came into the hospital that we wanted to test for COVID, we had to call the state health department and ask for permission, because when this started, we had less than 50 tests, and then we had 90, and then we had 190. And when we had 190, we thought we had the most tests in the world. At that point versus today, our interventions in the community and our mitigation strategies can be different, because we do have the capacity to test, right? You present to Providence Hospital, and they can run a test and relatively quickly tell you whether you're positive or not. We didn't have that. Do I think that we need to hunker down today? I don't. But I think that if we don't have this mandate continue, then we will inevitably get to the point where the community will be forced to hunker down, because we will start seeing cents in exchange for people's lives. So we know masking works, right? But it's got to be done properly. We know hand hygiene works, needs to be done properly. We know that social distancing works, but it needs to be done properly, right? I haven't eaten in a restaurant for the past month, because the last time I went out, I got seated in a table that was not 6 feet from the next table. And I said something about it, and I left. Prior to that, I was in a restaurant. They sat somebody in the booth next to me. I complained. The other person got moved. Little cheats like this add up, right? And I say something because I know the data, and because I feel comfortable saying something, because I'm protecting my fellow citizens and I'm protecting myself. We need a lot more education, and until that education sinks in, we need mandates. I have every faith that people are intelligent and that they will learn their way. It took me a while to get used to wearing a mask every single day, but we all can do it. And I'm an infectious disease doctor. If it was rough for me to think that I had to have a mask in my car when I was going to drop off my dog at the doggy daycare, it took me getting used to it. It's going to take everybody time to get used to it. And we need mandates.
Thank you. Ms. Eiler, did you have questions for the doctor?
I do. I have several, if that's okay.
Sure.
Thank you. Ma'am, thank you so much for being here. I appreciate your expertise. So I'm going to ask you questions that I believe you know the answers to, just for clarification to myself and to my community. This is Jamie Allard. So my first question would be, and what criteria would for not bringing patients into the hospitals would a COVID wards fill?
I'm sorry, I don't understand the question. Can you
What is
repeat
the
it?
criteria for bringing patients into the hospitals as the wards fill? What are your guidelines when you bring COVID patients into the hospital? As wards are filling up?
Usually because we thankfully have not had to get to that point. I will tell you that there have been other states where people are showing up to the hospital and they're short of breath and they might be needing a little bit of oxygen and they send them home because they don't have the beds. We have not had to get to that point yet. So I don't know what our criteria is going to be, but I don't want to be the one that gets turned away to go monitor my O2 sats while I watch them drop and I can't get a hospital bed.
Okay, so I'm going to continue on with, maybe you know the answers to these. So Regional Hospital received $800 million in CARES funding. Did you not believe a second wave was coming? They also made $1 billion in profit on second quarter. Let's see.
Ma'am, you are asking me questions that are for administrator level.
Okay, so let me just skip that one. I apologize. Let me go ahead.
I am a contractor at these hospitals. I have nothing to do with how they spend their money.
Okay, so then I would have another question. Since you work at both, are they still doing elective surgeries at the hospitals, at Providence and Regional Hospital?
At this moment, yes.
Is there adequate supply of protective equipment?
At this time, yes.
Okay, and so you're performing elective surgeries in a pandemic?
At this time, yes.
Okay.
And again, you're asking me questions that are to the level of the administrator. I am not the CEO, nor am I the CMO. These are questions that are not appropriate for my level of expertise. Let me make that clear.
Yes,
and
thank
these are
you.
questions that, we're talking about the economy as well.
Yes.
And hospitals are part of the economy, right?
Okay.
So they're making decisions also based on the supplies that we currently have, right? Elective surgeries that get postponed sometimes do end up in
Okay,
adverse
so we're in a
medical
pandemic,
outcomes.
they're doing elective surgeries. Just for clarification, and we've been making almost $1 billion on second quarter that I will address with the administration. Thank you.
Again, I'm sorry, but I think your questions towards me and your attitude are very misdirected, right? You're treating me as if I am the enemy who's getting rich out of telling people to wear a mask.
Thank you.
Right? I am not the hospital. I am not a corporation. I am tired of seeing people coming into my hospital, young and old, struggling to breathe. Do you, ma'am, have a medical background by any chance for you to tell me what should happen or should not happen with elective
Doctor,
surgery?
I'm going to go ahead and cut this off. Thank you for your testimony, or for participating. All right, I'm going to go ahead and go back to Mr. Weddleton.
Well, thanks. I think first thing I'd like to do is move to postpone until November 17th.
Second.
Move in second. Do you want to speak to it, Mr. Weddleton?
You know, I would. I have an amendment here that it would be a little better if it written up. I know we could do it verbally, but I also understand that, Ms. Kennedy had a couple, but she expected us to be dealing with this in 2 more weeks. So we want to be able to see those. So that would at least provide an opportunity for her to bring those forward tomorrow.
Thank you. Is there any further discussion on the motion to postpone to November 17th? Seeing none, members may proceed.
Mr. Chair, can I
go ahead, Mr. Dunbar.
Yeah, I'd say, and this is one of the reasons I voted against the original amendment last month. These resolutions can be overridden with another resolution. They do not bind the Assembly in the way that an ordinance does. So even if we had said that we weren't going to vote until the 30th, we could pass another resolution tonight that overturned such a resolution. And in terms of amendments, I think if we were to pass something tonight, you could always pass another resolution. You could lay it on the table tomorrow, or you could pass it on the 30th. that would accomplish whatever you seek to do through amendment. Again, because resolutions can be brought in that fashion. So I oppose this motion to postpone, and I think we should have the vote tonight. Thank you.
Thank you. Seeing no further discussion, members may proceed to vote on the motion to postpone to November 17th.
Chair, can I just ask Mr. Weddleton a quick question about that motion?
Sure.
Mr. Weddleton, what is your reasoning for it? Again, please, just for clarification.
Ms. Kennedy said that she had a couple amendments that she wanted to do, but she wasn't prepared because she thought she had 2 more weeks. So this is to give her a brief some opportunity to bring those forward tomorrow. And I've got a small one I could do verbally today, but I'd rather just have something written as normal.
Thank you. Ms. Kennedy on the motion to postpone.
Thank you, Mr. Chair. Thank you. I want to postpone for the very reason that Mr. Weddleton mentioned. I have been trying to get a response on an amendment that I would have liked to have brought forward. And then I guess I just didn't push it hard enough, thinking that we had till the end of the month to really discuss this. But I think also for the very reasons that, interestingly enough, that Mr. Dunbar brought up about the way things can be manipulated, strategized, whatever you want to call it. There are certainly opportunities for people to pass new resolutions, have new amendments or whatever at the next meeting, and for that reason he wanted to go ahead and vote tonight. Well, I think that actually supports the rationale behind waiting until tomorrow, because if there are things that need to be adjusted and we need to think through some of this and have the time to do it a little bit better, then I think we should take that time. So I hope that everybody will support the motion to postpone until tomorrow night. So thank you, Mr. Chair.
Thank you. Seeing no further discussion, members may proceed to vote on the motion to postpone to November 17th.
Mr. Peterson?
No.
Mr. Dunbar?
No.
Mr. Constant?
No.
Ms. Kennedy?
Yes.
Mr. Perez-Verdia?
No.
Ms. Salatel?
No.
That amendment fails 6-4. Did you have anything else, Mr. Weddleton?
Yeah, I'd like to offer an amendment, and it would add to the end of section 2, adding on to the last sentence, and the impact on the emergency brought about by existing and previous emergency orders. So it would read in its entirety. Section 2 would read, the mayor shall, if an additional extension of the proclamation of emergency, COVID-19, is requested beyond the date approved in this resolution, submit to the Assembly a written report detailing reasons the additional extension is requested, and then new wording, and the impact on the emergency brought about by existing and previous emergency orders.
Second.
Moved and seconded. Do you want to speak to it, Mr. Weddleton?
Yeah, I would. I think this is just the sort of the flip side of what we did with the First Amendment from Ms. Zolotel, where she said, before we do more mandates or actions, that we show very clearly, why we're doing it and what data, backs it up. And this just asks, we've been at this for 8 months, and we've done a number of things, and we should be able to see, we did these things and it succeeded in X, Y, Z, or we did these things and it did not succeed, and get those results. And my understanding, I asked the epidemiologist who spoke, and she said that now that we have testing and so on, that it is possible to do that. We can do something and see what the impact is.
Thank you. Is there any further discussion on the amendment? Seeing no further discussion on the amendment, members may proceed to vote.
Mr. Peterson?
Yes.
Mr. Dunbar?
Yes.
Mr. Constant?
Yes.
Ms. Kennedy?
Yes.
Mr. Perez-Verdia?
Yes.
Ms. Solotel?
Yes.
That amendment is approved 10-0. Anything further, Mr. Weddleton?
No, thank you.
All right, so we are now back on the main motion. Mr. Dunbar?
Thank you, Mr. Rivera. I'm going to speak in favor of passing this extension. I said several weeks ago, and I believe I reiterated last week, that our decision should be based on the performance of the virus, frankly, rather than some kind of political decision or our own kind of arbitrary timelines. We want to do everything we can to provide the public their input and to have thoughtful deliberations. But at the same time, they say sometimes the plan never survives contact with the enemy. And since we passed the last extension, we've seen exponential growth in the virus. We had more than 1,000 cases in the last couple of days, and that follows thousands more. We know that hospitalizations and deaths are lagging indicators, and we can expect them coming soon. So we have not ended the underlying state that necessitates an emergency declaration. And so for that reason, I urge support. But I also wanted to say something specific. There was a lot of testimony today about masks and referring us to the CDC. I'm on the CDC's website now looking at their page where they describe the efficacy and necessity of masks. And they talk specifically about the data. And I want to read just this one paragraph, which is heavily footnoted to a lot of peer-reviewed articles. And again, this reflects a lot of what the epidemiologists spoke to, but I wanted to reiterate it. The website says, 7 studies have confirmed the benefit of universal masking and community-level analyses. In a unified hospital system, a German city, a U.S. state, a panel of 15 U.S. states and Washington, D.C., as well as both Canada and the U.S. nationally. Each analysis demonstrated that following directives from organizational and political leadership for universal masking, new infection rates fell significantly. 2 of these studies and an additional analysis of data from 200 counties that included the U.S., also demonstrated reductions in mortality. An economic analysis using U.S. data found that, given these effects, increasing universal masking by 15% could prevent the need for lockdowns and reduce associated losses of up to $1 trillion, or about 5% of gross domestic product. So I hope that we continue with the emergency declaration, and we also continue with the mask mandate so long as it is medically and economically and statistically necessary. And I hope the governor shows some leadership and proposes one statewide as well. Thank you.
Thank you. Ms. LaFrance.
Thank you, Mr. Chair. We were elected to make difficult decisions sometimes. I wish we didn't have to extend the executive order of the emergency. I was prepared to let it expire, as I spoke to last time, at the end of the month and transition to a more stable form of government. But as it's been pointed out a number of times, the conditions have become worse, much, much worse, and not better. I'm convinced that a majority of Anchorage residents want a safe and healthy community. Many Anchorage residents support the public health protocols because they see the rise in cases, because they know people who are getting sick, because they see the stress that it is having on our healthcare system and healthcare workers, and because they want to get our freedom back and be able to move and shop and eat out. We need to take it seriously before the situation becomes dire. It's not too much to ask people to show some consideration for their neighbors, and we need to protect our frontline healthcare workers. They are a critical resource, and they are exhausted and burning out. This puts us all at risk. I appreciate the governor's recent guidance directing everyone to wear masks and follow social distancing. He's right. This needs to be taken seriously. If people would just do the simple things he has asked, we can get the mandates, we can get past the mandates and get our lives back and our local businesses back and our schools reopened. I get that people are frustrated and angry. I'm frustrated too. I want my kids back in school. We want our lives back, but we can't just wave a magic wand and have the virus go away. We need to listen to the scientists and the doctors, such as the one earlier who was on the line. I still have faith in the Alaska I grew up in, where we pull together in a time of crisis. We didn't just think of ourselves, we thought of others. It's not too late to show consideration for the health of our neighbors. Let's take control of the pandemic so we can end these emergency orders once and for all and open up our economy, our schools, and protect our frontline healthcare workers. So I am in support of this resolution tonight. Thank you, Mr. Chair.
Thank you. Ms. Zolotel.
Thank you, Mr. Chair. Both Mr. Dunbar and Ms. LaFrance have spoken quite eloquently and covered a lot of the points I wanted to cover. I wanted to just underscore two things. One is I think as we move forward and we do some refinements with the information we're putting out, we will be able to communicate perhaps a bit more clearly with the public about what's working and what's not working, and when we're getting closer to either points of tightening or loosening restrictions. The other point is, and then that hopefully we prioritize schools as we look forward in getting kids back in school. That is at top of mind for me, and I know so much of the community. We are, as one person put in an email, kind of at a precipice here, and we really have a couple of ways to go. And I hope that way is that we bring the COVID numbers down and we really put the kids first and put them at the forefront and work towards getting them back to in-person schooling. The second point or piece I wanted to underscore tonight is in the testimony tonight, I was a little bit disappointed to hear what, if you're vulnerable, you should just stay home. That's something stated from a position of extreme privilege. There we have a diverse and unique community that has a variety of needs, and we need to look out for everyone. And often those that are vulnerable, people with disabilities, people who are essential workers on the front lines, they're not available to come and testify to us in person, or may not have the availability to even submit written email comments. So I think it's just really important that we always look at our community holistically, and right now in this moment, doing that and putting that lens on, we need this emergency declaration to continue, and we really need to consider how we can be of service to all in our community so that they can get their needs met in a way that is safe, and that we're really thinking about not just those who can come and testify at an assembly meeting. Thank you.
Thank you. Mr. Constant?
Thank you. This has been such a wild week. First, we had ASD superintendent and the school board make a very difficult call not to go back to classroom, in school classroom. And that decision was painful. That decision was difficult. It was not political like some people would like to make it out. Then Governor Dunleavy sent a statewide emergency broadcast that we need to do our part, all of us, everyone across the state. That includes us as members of this assembly. And while I hope that the governor will do more, I will give him credit and say thank you for leading and telling the state of Alaska that we are in an emergency. It's interesting. Tonight, Mr. Eugene Carl Haberman said something that was pretty profound. People are confusing freedom with responsibility. People have a responsibility to this community to do their part to protect the public health as we move through this pandemic. There is light at the end of the tunnel. There are 2 vaccines coming to market by the end of a month that starts in 12 days, and hopefully in broad circulation in April in this community. I said in March and April and May and on that we should have tied our emergency extensions to the governor's, so we wouldn't have had to do this 6 times. But here we are again. And the proper action before us is to continue the emergency protocols until such a time as the emergency starts to fade. Thank you.
Thank you. Mr. Weddleton.
No, thank you. You know, when this started, we did something fairly draconian. You know, we shut down almost every business for 5 weeks and many for several weeks more. And when I look back at the number of cases back then and number of people sick, it seems almost quaint. It's just such a small amount compared to what we face now. And now vastly more. Now we've learned a lot. We've learned that the fatality rate that we feared isn't where it is. People can get over it at home and so on, but we're still seeing this thing is really growing. But if you look at our response to it, it's not that draconian. We haven't shut down businesses. I mean, people say lockdown. We're not really in lockdown. I mean, some businesses, restaurants and bars have occupancy restraints that are challenging for them, but other businesses aren't really locked down at all. The mask requirement obviously bothers some people quite a lot, but for most of us, you just wear them. It's not that big a deal. And and that's where we are now with, compared to where we were 8 months ago. So we've learned a lot. We've really tempered the reaction to it. And I get a sense with Mayor Quinn Davidson that she's that way. She's being very careful and not swinging long for to do stuff. As a business owner, the idea of just going laissez-faire, just like let us decide. And we tried that in the summer, and then the cases rose pretty steadily because people got very casual about things. And between now and herd immunity or whatever, if we do laissez-faire, there's an awful lot of damage. And I see in my business now, that I've had trouble staffing it. We've had to close for a couple of days. We've shortened our hours just because of staffing. And that's my little business right now. And as things get worse and there's more infections in society, you're going to see businesses hurting, but not because of the very light mandates, but because of the reality of the virus. And I think, businesses looking at the mandates are really missing the real boogeyman in the room. There's a lot of reasons to support this, extending this, and actually I do support extending this. I'm going to vote against it, though, just for the reason because I'm a little shocked. I'm very shocked that we did not delay it for 1 day to let Ms. Kennedy get her proposed amendments together. She's smart. They'd be worth looking at. I haven't seen them. But the impact on this emergency would be zero by delaying for 1 day. And we should show respect to each other in that regard. So I'm a no vote, though I do think we need to extend it. Thanks.
Thank you. Ms. Allard?
Thank you, Chair. So I'm just going to finish with some of the comments that I wasn't able to earlier. I was cut off. So I just wanted to put out there in regards to the regional hospital, they did receive $800 million in CARES funding. And I was just curious that if they ever thought a second wave was coming. They also made $1 billion in profit on second quarter, and was there a chance that the reason they had short staffing was a result of profit motivation? Regional hospital staffing at the hospital has been done and traditionally by traveling nurses. Were those nurses furloughed during initial outbreak, and if so, why? If they knew a second wave was likely and staffing was going to be an issue, why would you lay off your traveling nurses? So lastly, I would just like to say that the governor has not made a state mandate for wearing a mask. He has encouraged everybody. And in saying that, I want to include that the relationship that you have with your provider and yourself to determine what works best for you should be honored. The doctor that was on the phone tonight, the epidemiologist, is not my doctor. I would always go to my provider to give me the medical advice that I need. Thank you.
Thank you. Ms. Kennedy?
Thank you, Mr. Chair. One of the things that affords me an advantage of being at home, I mean, obviously it's it's always better to be in the chambers, but one of the reasons for staying at home was it does help allow more people to actually be in person in the chambers. But I typically watch the live stream of the YouTube video, and it's very interesting to watch the chat and the different kinds of comments that show up. Sometimes they talk about how tall somebody is or what color their hair is. But one of the things that I think is problematic is the amount of information that's probably, going through that chat that's not really correct. And one of the things that I thought was worth correcting is that our federal funds, whether it be the COVID funding or FEMA funding, is not based on whether or not we have a declaration of emergency in place. So I just wanted that there was a comment to that effect that the declaration is necessary for receiving federal funds, and I thought we had kind of clarified that in meetings past, but I just kind of wanted to make sure that people understood that that's really not part of what part of what's related to this idea of having the declaration passed. But there are several things that I think are components of this conversation. And what I did appreciate, I guess I take a little bit of issue with Ms. Zolotel's issue about people staying home. We know that works. I'm not telling anybody that they must stay home, but I absolutely believe that if somebody believes that they have enough of a health risk that they don't need to be exposed to the virus, then their best defense is actually staying home and making sure that they're very careful about who comes into their home if they have people come into their home. When the doctor was talking about there being a false sense of security in some cases, and I can't remember exactly what she was referring to, but I believe that the mask can also present that false sense of security. We know that masks can hold the virus in it for several days, and if you took it off because you were in the store and then you put it right back on a little bit later, you are risking the idea of exposing yourself to the virus. It just depends about how much viral load you might have gotten at that point. And, so people do need to take that into consideration. I think it is important to wear a mask in a lot of different situations, and I think it does help reduce spread, but it will not keep you from getting COVID, and it will not keep you from spreading COVID if you already have it. And I think that is absolutely the thing that people really need to understand about that. So I think all of us are trying to do the best we can at trying to reduce the spread, reduce our exposure. Obviously the hand washing is important. The separation distances are important, especially if you don't believe you can risk potentially being exposed. So I think people are learning. One of the things that the doctor talked about was this idea that it was going to take so long to educate people. I think people pretty much know the best way to protect themselves. I think if there are those that don't, that could be because of a language barrier, and I think that's important that, that's something that we probably need to make sure is being better addressed. But I just can't imagine that anybody in this nation, or actually, well, I'll say at least in this nation, don't understand the gravity of the situation and don't understand the potential precautions that can be taken to lower their risk. I think we all get it. I think what it really comes down to, though, is to what extent the government thinks they have to go to in order to make sure that everybody's paying attention and doing their part. I continue to be amazed at the people that point fingers. Oh, you're wearing a mask, you must think that you're invincible, or you're not wearing a mask, therefore you're spreading your germs to all of us. And you don't know that. I mean, we know that we have people who are asymptomatic. We know we have people that have recovered from the virus. We know that we have people that need that exemption, that exception from wearing a mask, and we've provided for that, whether it be a mental reason or just a physical reason. So we're allowing for that, and people need to give each other enough space for that, which again goes back to that idea of making sure that you provide enough space between yourself and somebody who's not of your household. So speaking of households, that, interestingly enough, is the one place where COVID is being spread the most right now. The highest risk of catching COVID comes in a person's home. Now, what kind of scares me about that is the idea of going back to what this resolution says, and what's been kind of my aversion of this from the very beginning is in the last it's not even in the last whereas, but in regard to what the emergency declaration does, it gives the mayor so much power. It says the mayor may implement any orders necessary to prevent the transmission of infectious disease and to ensure that all cases of contagious disease are subject to proper control and treatment. And that line right there, when it says any orders necessary, again, we go back to this idea of questioning, okay, so to what extent does that mean? Does that now mean that our government, this municipality, if they decide that there's too much spread going on in a home, that they could enforce some kind of restriction within a home? And that is absolutely the fear that a lot of people have, not knowing to what extent their own government could move against them in restrictions, in requirements. And we don't put any parameters on that. And the really sad part about it, and I've talked about this before, is the Assembly is basically left out of every decision of any emergency order until after the fact. So we don't get to talk about it beforehand and decide, hey, what's the best way to move forward with this? We have to wait until something's happened, and then maybe we can respond appropriately. But to me, that's the fear of what might be coming next that people have this greatest aversion for. One of the things I wanted to do in an amendment would be to try to put some parameters, some bookends on that kind of specific power, so that we wouldn't have people being in fear of what could be coming down the pike. We all know that the cases are going to continue to spread. We should have known this 8 months ago. In fact, I'm a little annoyed that our hospitals weren't more responsive 8 months ago, knowing what was coming, and now we find ourselves in this position. So I think there are some things that we should really be looking into in terms of doing some kind of certification requirement, waivers or something, maybe using volunteers a little bit better, especially those who've recovered from the disease. But anyway, regardless, this all goes back to the fact that it is so dangerous to have this level of power in a time when things are so unknown that nobody really knows what's coming down the pike in terms of restrictions and requirements and mandates. So for that purpose, I mean, I certainly can't support this. This is, just looking at it as a whole, I certainly understand we can do things to help people prepare, to help people make good decisions. But when you come right down to the fact that we have the ability to do whatever is necessary in other words, the ends will justify the means, that's just totally unacceptable. So probably no surprise, but I'll be a no vote. Thank you, Mr. Chair.
Thank you. Mr. Constant.
Yes, thank you. Sorry to get back in, but on the theme of incorrect information that needs to be corrected, one of the previous members has a number of times made Wagner's wild guesses not easily refuted, that regional hospital has made volumes of $1 billion, and that they took a bunch of CARES Act money and they're just profiting, and it's, there's some weird conspiracy where you're drawing sticky notes with strings between them in a quixotic manner. But if you go to investor.hcahealthcare.com, which is the company that owns Alaska Regional, you'll see that HCA Healthcare does $50 billion annually, but that revenue is across 187 hospitals and 2,000 surgery centers. And they report that they are returning all of the COVID money that they received in quarter 2. So while it's easy for members to speak as if they know something, it's abhorrent to the truth to speak without knowledge.
Mr. Constant? You back with us, Mr. Constant?
Yes.
Okay, please continue. Do you want to continue, Mr. Constant?
That's good.
Okay, thank you.
Mr. Chair, you have the floor.
Thank you, Mr. Vice Chair. So today, much like many of the prior extensions that we've had, we've heard a lot about individual choice, individual rights, individual privileges. I think this is one of those rare instances where I will agree with Mr. Haberman. The way that I see this is individual responsibility. There are times when we as a community have to take responsibility and make tough choices. Ms. LaFrance, I think, stated it very correctly. We were elected to make some of the tough choices that we have before us. And thankfully, we have the privilege of being a home rule city. So unlike many other jurisdictions, we have this power, we have this responsibility, and we have this duty. And I don't know any member of this body that takes that responsibility and that duty lightly. Most businesses get it. They understand this idea of community responsibility. And their businesses are being hurt because of irresponsibility. That's why 82% of businesses who responded to a Visit Anchorage survey, which President and CEO of Visit Anchorage, Julie Sapi, talked about earlier today, 82% of those businesses who responded to that survey supported policies requiring mask usage, social distancing, and other best practices, which are currently encapsulated in the emergency orders. Businesses get it. When we fail as a community to control the virus, we are failing businesses. Most individuals get it too. That's why an October 9th survey done by the UAA College of Health and ICER showed that 94% of those who responded to the survey support the municipality's response, 64% support the municipality's response to the pandemic. And that mirrors very closely the calls, texts, and emails that I have received. And, I think there were some folks who were speaking earlier that wanted us to focus on the people in the room. I think it's really important for folks to realize that this room is much larger than the people who are here. This room includes many more thousands who are watching online, who are watching on TV, who have emailed us, who have reached out to us. So this room is a big room. And it is clear to me what my constituents feel about this emergency declaration. It's also clear to me that my constituents want to get back to normal. They want to get back to school. They want to have normal holidays. But most individuals understand that we have a community responsibility. One of the folks who testified earlier today, they talked about the American dream. And they said that the American dream is dead. Well, I hope that that individual opens her eyes, because that is not at all what I am seeing. The American dream is not dead. I am seeing businesses be resilient, businesses be creative, and new businesses sprout out of this pandemic. So I will be voting yes to extend the emergency declaration. A couple other comments. In regards to what Mr. Weddleton said earlier about being respectful also means being ready to vote when we have an item before us. And most of this body is ready to vote today. I invite Ms. Kennedy to bring forward a new resolution with her ideas if she so chooses. Last, I agree with a lot of what others have said about the need to be clear, transparent, provide justification for any new orders or extension, and to look at a way, seriously look at a way, to transition away from an emergency declaration. Thank you, Mr. Vice Chair. Seeing no further discussion, members may proceed to vote.
Mr. Peterson?
Yes.
Mr. Dunbar?
Yes.
Mr. Constant?
Yes.
Ms. Kennedy?
No.
Mr. Perez-Verdia?
Yes.
Ms. Salatel?
Yes.
That item is approved 7-3. Next on our agenda, we have final audience participation. So for final audience participation, please direct your comments to the Assembly or the Chair and not to anyone personally. As a reminder, if we didn't have initial audience participation, but you cannot speak again on the same item if you spoke on item 4A on our agenda. But happy to hear any other thoughts on other items. Welcome.
Hello, Chair. Well, what we are being told here is that it would be inappropriate for us to have a proper investigation of your COVID-19 emergency powers, and in your obsession with seizing these emergency powers.
Sorry, could you state your name again, please?
My name is Jason Agri. And in your obsession in seizing these emergency powers, in your desperation, you continue with your misconduct by denying us due process and failing to investigate this emergency in a fair and just manner. Due to oversight, failure to oversight, error, or incompetence, you are failing to do your due diligence and violating due process of the people of Anchorage. You are unconstitutionally denying us a fair and just investigation of these proclaimed emergency powers. You as politicians, you can make political decisions. Just because you won your election does not make you qualified to make this call. You should have put this into a body, an independent body that is not subject to political coercion and that's independent politically to make this decision, help you guide you through this. Because I know that you want your power, like you talked about. But it's becoming clear that in your desperation to preserve this dream of tyranny, that you seem to be happy to destroy the due process of the people of Anchorage. You seem to be happy to deny us a fair investigation. You are happy to destroy businesses and make thousands of people unemployed and poor. Well, we the people look and we see that your game is up. Your fanaticism is out here in the open. And untold thousands must suffer so that your dream of control can continue. And what I want to know, and what everybody would like to know, is who the hell you people think you are. You know, what you're doing is very, very, very dangerous indeed. And in your desperation, you have become the silent assassins of our democracy. You're acting to destroy our market-based liberty. Well, this is not going to work, because when you remove any remaining traces of democracy, when you destroy every last semblance of fairness, and when you unjustly make thousands of people unemployed and poor, people realize that your game is up, because we don't want your leadership. We don't want your bullying, because when you rob people of their democracy, all we are left with is an option of violence. And for our future, and for your safety, and for our security, and for the sake of our community, we want your unlawful, unfair, unjust, unconstitutional power grab terminated and resigned to the dustbin of history.
Thank you for participating. Would anyone else like to participate? No, no one on our phone list. Welcome.
You can hear me? My name is Eugene Carl Haberman. Last resident for over 43 years, 20 of those years Anchorage resident, and currently the Valley resident. First, I'd like, because I attend so many meetings and years of meetings and witnessing process and so forth, I'd like to bring out a standard that I've seen as assembly members that I would remind you what you normally do, the normal. From time to time, you'll have items before you, and there is a question to vote now or vote later. And when there's assembly members who have, for whatever reason, A to Z, the general consensus has been assembly members respect that delay to give some time of thought and not vote that night. So I remind you of that because I remind you of that situation because there's some time, whether it happened tonight or in the future, other assembly members are going to ask that. You may ask that if you did not ask it tonight. And there's going to be a sense of unfairness. It's not only the conversation and fairness of you with the public in that conversation, it's also a sense of fairness of you among your fellow members of the assembly. And that needs to be taken, and that needs to be sensibly addressed and respected. So I'd like to also say there was a word said tonight, false sense of security. These were words that I used back in May, Memorial Day weekend. When I used those words, our governor was seen in the valley at a ceremony without a face covering, crowd in a very crowd, where just previously he was telling Alaskans to social distance and recommends wearing face coverings. And so I went out to Anchorage Assembly meetings, went out to Borough Assembly meetings and reminded the public that our governor is providing a false sense of security. That's where it comes from. Those are my words. You will use the words tonight, but it's not where its meaning was not what it was, what I said. And we still have a governor who put an alarm out. And the day before that information was out, what was the sense of doing that? But I'll remind you too, is you have to deal with a situation over 100,000 people live in the valley. We're a good core of those people who work in Anchorage. And it's a wild, wild west, respectfully, very dangerous, and a place where the Borough Assembly there is basically doing the following. They say they're going to demand wearing face coverings in the buildings. Last Saturday, they did not do it themselves. I was there for several hours. They took them on and off, and I was a sole witness of that. So the media, that's fake news, who said that they're going to do it. They're not doing it. But I'll leave you with just closure. Because the borough cannot do an ordinance for face coverings, the governor's in charge. Thank you.
Thank you for participating. Would anyone else like to participate? Welcome.
Good evening. Thank you. So this is quite terrible. What it is control. You want to control us. You want to hurt us. You are hurting the community. It's just quite horrible. But I have thought of a brand new business that I could probably do very well and be very successful, and that's barf bags. This is despicable. This is disgusting. And you are so correct, Felix. What you see in this room here is just a tiny bit of Anchorage, Alaska. But again, as I spoke a few weeks ago, you have woken the people that have been complacent. When you wanted to buy those 3 buildings, things have changed. Things have changed, and you will see that when the elections come up. I have never seen this again in Anchorage. All these recalls that have been denied by the powers that may be, It certainly isn't the clerk's decision to make that decision. She's the one that's to be contacted. I have never seen anything like this. You're not allowing us to clap. You don't allow us to laugh. You are suppressing the people of Anchorage. It's cruel. As much as you say, thank you, oh, please, that's all little niceties. You really are not nice people at all. Thank you.
Thank you for participating. Would anyone else like to participate? All right, seeing no one, can I get a motion to adjourn?
Move to adjourn.
We're adjourned.